Mr. Ahmed Al-Banna, who is a healthcare innovation and transformation advisor in public health consultancy. Also, I would like to thank all of our sponsors, GE Healthcare, who is our strategic partner, Vocera, MPC, Modern Pharmaceutical, and MyHemp. I hope you enjoy the event, and I'll leave the stage now for Ahmed. And I'll leave the stage now for Ahmed.
Technology. Perfect. Hello, everybody. Ladies and gentlemen, very nice to meet you in person. And I believe that one thing we have all missed is this, is seeing you all here, talking to you, breathing the same air, which could be a bit tricky, but we miss it.
And I'll leave the stage now for Ahmed.
And I am. Technology. So I would like to welcome all of you. The third, hello, everybody. Ladies and gentlemen, Congress. Very nice to meet you in person. And I believe that it's been 2 years. One thing we have all missed happening, and you all here talking to you, breathing the same air. I would like to dedicate and provide special thanks.
And I'll leave the stage now for Ahmed.
That has been doing marvelous work. So I would like to welcome all of you. Life back. The third, how it was. Ladies and gentlemen, Congress. Very nice to meet you in person. Vaccination campaigns, I believe that all the regulations, one thing we have all missed, gradual opening up, and when I talk to my friends and say we have only had 1 month of lockup, they were like, "I'd like to 1 month of lockup." I was like, "Yes, but we only have been locked up for 1 month, and we're doing
now for Ahmed.
That has been thanks to the city of Dubai as well." I would like to welcome all of you. So COVID-19 has proven global healthcare systems to be very nice to meet you in vaccination campaigns, that all the regulations, we have all missed, gradual opening up, and a lot of things. When I talk to my friends and say we have only had 1 month of healthcare systems being stretched to the maximum, we only have been locked up for 1 month, and we're burning out. That has been thanks to the city of Dubai as well. Medication is critical. So COVID-19 has proven global healthcare systems we never thought to the vaccination campaigns. We've seen them being the regulations, we have all missed, gradual opening up, and a lot of things. When I talk to my friends and say we have only surgery demands in areas we never thought could happen to the maximum, we only have been locked up for 1 month, and we're burning out. That has been thanks to the city of Dubai as well. Medication. We have realized. So COVID-19 has proven global health. The way they are designed today to the vaccination are not solid enough for them being the regulations. That's one thing that we want to talk about today. A lot of things. When I talk to my friends and say we have less surgery demands, things areas we never thought could happen to the maximum, we only have lived to understand that whatever we've been doing before COVID, it needs to change. We have realized. So COVID-19 has proven global health. The way they are designed today to the vaccination are not solid enough. So the crisis has taught us that priorities change. We want to talk about and a lot of healthcare systems. My friends, we know we have less surgery. Things areas we never thought could happen to the maximum. We only have lived to understand that whatever we've been doing before COVID, what matters to change. We have realized. So COVID-19 has proven, unfortunately, that when the are designed to have been among not solid enough. So the crisis has taught us that priorities change. We want to talk about and healthcare systems. My friends, we know we have less surgery. Things areas we never thought could happen to the maximum. We only have lived to understand that whatever we've been doing before COVID, what matters to change. We have realized. So COVID-19 has proven, unfortunately, that when the are designed to have been among not solid enough. So the crisis has taught us that priorities change. We want to talk about and healthcare systems. My friends, we know we have less surgery. Things areas we never thought could happen to the maximum. Starting from the we have lived to understand that whatever we've been doing before COVID, what matters to change. We have realized. So COVID-19 has proven, unfortunately, that when the are designed to have been among not solid enough. So the crisis has taught us that priorities change. We want to talk about and healthcare systems. My friends, we know we have less surgery. Things areas we never thought could happen to the maximum. system and those three areas are all under the umbrella of value-based care. We need to understand how do we change our healthcare systems to work to create value and not work to treat the sick. We need to create the value and calculate that, how to improve value for each dollar spent. I'll not take much more of your time. I would love to leave the floor for the other speakers. And today we stand here with an open mind, an open heart, and open pockets for investments, looking at how we can attract more investments to this nation and to this region and this part of the world. Just to give you a quick number, the digital health platforms are seen in the GCC are expected to grow by 12.8% to reach $1.8 billion by the year 2026. And this is a lot of investment, lucrative numbers, double digit, which we don't really see nowadays. And today we're going to talk about that, opportunity for investments. We're going to talk about digital health adoption and transformation. We're going to talk about the health workforce and the physician of the future, how we can work on that. And finally, we will talk and touch upon innovations that can help us streamline digitization and move the compass in the true north direction. Thank you so much. With that, I would like to welcome our first keynote speaker, Anit Numa. Anit is a digital transformation advisor for e-Estonia. She focuses on bridging the gap between the private sector and the public sector in order to create better outcomes. And she's trying as much as possible with her transformation advisory to show how Estonians can help leaders in leading their digital transformation using the brains of Estonians. Please, the floor is yours.
Good morning also from my side here. I would actually like to start my keynote by quoting His Highness Sheikh Mohammed Al Maktoum. He has stated, "I want my people to live better now, to go to good healthcare now, not after 20 years. I can tell you a little secret. The only way to succeed in this goal is to actually push innovation in the medical sector. We know that we have aging population. Secondly, also we have many clinical also diseases and chronic diseases. At the same time, this really puts a lot of pressure on our entire budget when it comes to the medical sector. So I would say that medical sector and innovation in the medical sector should be our one and biggest priority today because it's crying for innovation. I will tell you today, here in the next 20 minutes, how Estonia has become one of the most successful countries when it comes to innovation in medical sector and having all of the medical records today working fully online. So to start with the first slide here, when we talk about the medical sector itself, I guess everybody here in the room would absolutely agree with me that when we think about what kind of information do we have in our online platforms, then maybe you can survive if your university grades will leak somewhere or would be hacked. But would anybody of you here be fine if your medical records would be leaked somewhere and hacked by the hackers? I would say medical information is the most sensitive information that we can store of our people. And that's why having a very secure infrastructure is the most important thing right now to Estonia. So I wanted to start with a slide that gives you an overview why Estonian e-health system is one of the most secure ones and why I can sleep peacefully at night knowing that this information is secure and sound. Estonia has a 3 pillars approach when it comes to storing our medical information. First of all, confidentiality. Secondly, availability. And last, integrity. Starting with the first one, when we access our online platforms, then obviously we can't do that by just having usernames and a random password, because this is the most hackable thing. And this is what time has showed us. We provide our confidentiality and our identity fully remotely by using either identity card, mobile ID, or also a smart ID solution. They both come with two different PIN codes, so I can securely log into the system, and I'm the only person here in the world who knows my PIN codes by heart. Secondly, if we have successfully logged into the system, we also have to be able to exchange information between different medical service providers. And I can tell you that Estonia has chosen a secure system where everything, when it comes to our data, is actually decentralized between thousands of different medical service providers. So there is no large cloud or a database where we would have all of our information data of our doctor visits, analysis, and so on, because we don't think this is secure, and I would really suggest you never go that way either. Because we have been storing our medical information physically actually in hospitals. And all of these hospitals and medical service providers are connected to each other over the decentralized data exchange layer called the X-Road. And that helps us to exchange information between different platforms, and every time that we do that, this is fully encrypted and of course also time-stamped, so that we can track every single data exchange between different platforms. But I will get back to that a little bit later. And then last but not least here on the three pillars is integrity. We have to, of course, also provide the integrity of data, and I can tell you that Estonia was the first country in the world who also started using blockchain on a national level in order to store and provide the integrity of our medical information. So when I have a doctor visit, and usually if you go through some of the analysis, there is just not only one single doctor that is investigating you in a way, but there is plenty. But for me, it's just one single summary in my medical platform. And every single time there is a new doctor adding information to my summary, there is like a hashes on every move there, so that the next doctor is not going to be able to delete or edit any information that has been submitted by the previous doctor. So that's impossible to manipulate with our information. So once again, if somebody is asking you from an elevator how Estonian medical system has been built, and if you have only one single minute, then always use this slide here. Confidentiality, availability of information, and integrity of data. And if you would try to take one of these pillars away from here, the state or the medical system would just collapse. So I don't recommend that to anybody. But to continue here, on the next slide, I also wanted to show you this slide here because many, many times when we welcome delegations in Estonia and they come and really try to understand how we have built this system, sometimes they come with expectations that these things happen overnight. I want to have prescriptions working online next year. I want to have all of our medical records online in the next 2 years. There is a little timeline for you. It took some time also for us. If you look at the first number here, 2001, that was the year when we implemented the system called the X-Road, which I introduced you, which is our decentralized data exchange platform. 1 year after, we introduced the electronic identity cards, which are compulsory documents to everybody in Estonia. So 98% of our population has this identity card. After this, as you can see, it took 6 years. It took 6 years to implement e-health system because we needed to prepare, of course, also everything by the legal background. By today, we have 99% of our medical records already online. And of course, also prescriptions, which if you can also see here, it took approximately 2 years' time after the e-health system to also push the e-prescriptions working online. We can get access to our medical prescriptions by using our identity card just by going to the pharmacy and handing it over to a person who works at the pharmacy. We have some great news that Estonia is not the only place that we can use this identity card. I can today also travel to Portugal, to Finland, and to Croatia, and get access to my medicals by my Estonian card also there. I can tell you that I really can't wait for the moment that I would travel next time to Dubai, and if I need access to my medicals, I could just use my Estonian identity card and go to the pharmacies here. And that's why we need to work together. That's why we need international collaboration, and especially in the medical sector. And I would say the time of pandemic really showed us why this is necessary. To move over here now, for some reason, the background is black, which shouldn't be that way. Today, as I said to you before, that we have 99% of our health data already fully online, 99% of our prescriptions are issued online, and we have, of course, also e-ambulance working online, so whenever something would happen with you, then the ambulance would get access to your critical information as soon as possible by just knowing your identity number, so to really provide you the best medications. And when we talk about what's essential in the healthcare sector, then I told you before, when we exchange information between different platforms, we also timestamp every single move. And why we do that is because we want to give a lot of transparency of the system. Transparency not for the medical service providers, but transparency for our citizens who really care about their information. Because the truth is that medical information belongs to each one of us, not to the government, not to the medical service providers. This is our information. And in order to really ensure that our information is safe, and again, we will know who is using this information, we have provided a solution called the data tracker. Every single time there is a doctor or medical service provider looking for my information, I can track that from my data tracker. At what time of the day, in which hospital, which part of my medical records they were looking for. This information is available all the time. And besides that, we also have an opt-in and opt-out system, which means that I can look for that every single time. If I have a doctor visit, I can decide whether I want the next doctor to be able to see this visit or no. You might ask why. Sometimes we might have doctor visits that are a little bit more sensitive ones. But secondly, if you get also a diagnosis that is very, very bad, what would happen with human beings is that we're like, maybe that doctor was wrong. Maybe I'm actually not sick. I want to have the second opinion. I can close this doctor visit and this diagnosis and go and see the next doctor. And they can make me the new analysis. And I can see if these actually matched each other. So we have this opt-in and opt-out system that people like to use sometimes. But once again, I was doing some research, like how many people in a year actually close some of their information. If I could listen to you right now here, I would just ask to you, like, what do you think, how many people? But I can tell you already that there is only 500 people in a year who close their information, which automatically shows to you that we have trust, so that we don't have to close that information. We're also working on having a very personalized medicine system, which at the same time also creates better treatments and diagnosis, but I will also come back to the personalized medicine system on a couple of slides as well here. And then, of course, AI is essential in the medical sector today as well, because we can do, again, much more quicker analysis and optimization in our information. And then, of course, also, when we talk about the access to our medical data, then this is also legally divided to 5 different levels. So if you think that your family doctor is able to access all of your medical records, then that's not true. But if we talk about, for example, some specialist, then they might be able to see much more of your information than your dentist. So there is 5 different levels of access to the information, and that once again shows the privacy and data protection of our information there. And of course, we do also have a booking system so that people can set themselves an appointment without having to be on a line with a doctor and trying to find the best suitable time, but they can choose from their schedule and really make an appointment, get the notification to the phone, and all of this with also public healthcare service providers. To move over here now, when we talk about the data exchange, then first of all, data exchange between different platforms are managed in a way that we have time-critical data, the summaries, hospital visits, medical images that are usually exchanged by different doctors and medical service providers. And of course, also when we talk about the nationwide medical system, we also also have e-prescriptions, ambulances, drug-to-drug interactions as well, so that they can change this between each other. But most importantly, I also wanted to give an example how we exchange this information on a cross-sector services. I do not know how this is regulated here in UAE, but in Estonia you have to change your driving license every 10 years. But in order to get the new driving license or to update that, you of course also need to provide that your medical situation is okay. And that requires a doctor visit. But our doctor visits again are in our patient portal, accessible there. And in a case you have had a doctor visit in the past 5 years, there is no need to go once again to the same analysis, but you can just transfer this information from your patient portal to our road administration office portal that is working online. So also these information is being exchanged on a cross-sectoral level, and besides that, if our guys are starting their military service, they also need to go through the checkup. If they have done that again, let's say a couple of months before, there is no need to waste your time and to go through that again. And that is the reason why we need to have this cross-sectoral data exchange also between different portals. To move over here now, and also to talk about the ongoing projects and future plans that we have for Estonia today. So as I brought it up before, we are working on a personalized medicine system already for a couple of years. A couple of years ago, we collected, that was offered for free for Estonian citizens, and 20% of the entire population gave their gene test to us. We've been analyzing this information now, and based on that information, we can make our medical system much more personalized. First, there is two levels that we can use this information for. First, to the citizens themselves. If they are in any kind of risk group, we can inform them before. Say that in next 10 years, your risk to suffer a heart attack might increase based on your genes. We want you to come for a checkup every single year to make sure that you're okay. Again, to provide this also predictive measures to our patients based on their genes, or to even discover some of the sicknesses that you might not even have symptoms yet. This is what the gene tests are meant for. Besides that, if you know the gene test 20% of your population, that also helps us to do much smarter political decisions. In our Ministry of Social Affairs, where they're going to start analyzing this data, and based on that information, we can see what are the sicknesses that our people are suffering the most. Can we change their living habits? Maybe they should eat more healthy in high school already. Or maybe they should work out more. There are so many different ways that we can really make our people to live longer and much happier by using the information that we have been collecting. And of course, also going back to the citizen side, if you go and see a doctor, that they wouldn't just randomly write you a prescription in medical. But if they do write your prescription, they would consider information of your genes. And based on that, they could write you a right medical that actually works on you. So that's why we need to start using data that we have been collecting to make better decisions for tomorrow. And of course also AI, as I mentioned before. In general, Estonia already replaced 50 public services by AI technology just in last year, and this is going to stay as one of our priorities also for the future. And then, of course, proactive services, so that we can really, again, ask people to come for the checkups all the time, and like proactively contact them so that they wouldn't have to think about these things when it was the last time that I had a visit. But we have this data, and we should really proactively use that for remind people some of the things that it might be not on their head. And of course, when I talk about the future, we need more and more ways to have remote verification methods. And why do we need to have that is because of telemedicine that is becoming also an essential part for the future. So you remember what happened in a time of pandemic, when everybody were afraid to even go and see a doctor in person, because going to the hospitals was kind of risky. I postponed a couple of my visits for many, many months, being very scared before I get vaccinated. But also in the future, I see that we can start having the doctor visits by staying at home. There are so many companies in Estonia today who try to provide these telemedicine solutions and of course also remote consultation. Remote consultation between patients and doctors, and remote consultation between different specialists and doctors themselves. So before your family doctor is going to send you a new specialist, they can send your first results to a specialist and ask whether this person needs to come and see you. We can make these queues much, much shorter and waiting times much shorter if we really can have this kind of quick conversations between doctors and of course also our citizens themselves. So I would like to sum it up here by saying that if we really want to build a healthier future together, then my suggestion is to work together on international level, not to do things only internally in each of our countries, but to share the best lessons and experiences that we have learned and to really make sure that we have always a citizen-centric approach. Because we all want to be living longer, healthier and happier, and only by pushing innovation in the medical sector we can achieve this result as I started in the very beginning. And there is no finish line here, because I'm totally excited to see where technology can take us in the future. So from my side, I would like to wish you a very nice rest of the conference. And I'm pretty sure that having all these smart people sitting here in the room, by the end of the day, you can come up with solutions that really transform the future of UAE. So thank you from my side, and have a wonderful day.
Thank you very much, Annette. It was a great talk. Now, over the past 2 years, there has been a really unique topic that we've seen on RFPs and on our daily jobs. It was the hospital of the future. We have been asked many times to provide thought leadership on what would be the hospital of the future, how would it look? And to answer that question, we need somebody who has been on the other side of the story, somebody who has been behind machines within hospitals, somebody who's obsessed with operational excellence and with innovation, somebody who's obsessed with artificial intelligence and machine learning. Ronnie Gurji from GE Healthcare Digital is the director of Middle East and Saudi, and he also acts as a product manager for the MENAT region, Middle East, North Africa, and Turkey. And he's that person I was describing, so if you take us through that, it would be great. Thank you so much.
Thank you. Thank you. Good morning. So, thank you for the introduction. So, I will just go directly to the topic here. So, as we mentioned before, hospital of the future. Now, before we talk about the hospital of the future, when we say future, this means change. In order to be able to drive change in the healthcare, specifically in the healthcare sector, we need to be able to do a proper study, proper analysis, especially that we are treating with clinical data sets, with patients, and we are treating patients at the end of the day. However, we have something in the data, right? We have something called real data, real world data. And this is exactly similar, it's exactly the same in the industrial area or in healthcare. Those are data sets sitting there, and if we don't use it, at a certain point, it will become a serious issue for us. Now, in order to be able to drive change in any business on the industrial side or even on the healthcare side, we need to be sure that we follow the life cycle of the data. So the raw data sets are sitting there. If we don't use it at a certain point, we will lose it, or it will become a problem for us that we have to handle after 5, 10, or 15 years. We start in the life cycle of the data. We will start with the extraction of the data. We will extract the data, analyze it, categorize it, and then we will move to refine the data and store it. Now, of course, it's slightly different between industrial and healthcare because at the end of the day, as we said, we are treating patients. We are talking about patient lives here. So after extracting the data, refining the data, we need, at the moment when we extract it, we need to make sure that we analyze it. First step. Second, we need to anonymize it. So, I mean, you might have heard Annette, she mentioned that patient clinical data sets and the patient the data exposure, and I'm going to come to that in the next slide. So extracting the data is yes. Two, we need to anonymize the data. When we anonymize it, we package it, and we make it ready to be utilized. Now, how we consume it, this is the key. So it depends on the industrial area. This is will result the production of fuel, car, energy, power, aviation, whatever. And in the healthcare, the data recently took a completely different direction in the AI innovations, and then training AI models based on patient clinical data sets, and of course, verify, analyze, and adopt. Now, back to the data again, before we go to the deep dive in the healthcare discussion. So the life cycle of the data is like gonna reach out to the point where it's the peak, where the patient is visiting the hospital, getting scanned, images ready, report produced and analyzed or approved, and then patient treatment being decided on by the physicians. Now, after that, the data is being stored. Now, whether patient images, lab results, any other clinical data sets related to the patients will be stored at different IT solutions, sometimes silos, they don't talk to each other, which might impact as well the patient treatment, and sometimes it's consolidated on a centralized solution like the VNAs of the world, like the Health Information Exchange platform, which is normally on a national level or governmental level. Okay, what will happen after this point? After storing the data, even if the data is, as we said, it's packaged, it's clean, if I don't use it as a healthcare provider, I mean, I can use the data for different reasons. For example, as we said before, we can use it to generate or to produce AI models or to train AI models. Health population management. Depends on the different countries, they utilize these data sets in a different way. However, after being stored, if we don't utilize it in the right way and consume it in the right way, the data, nowadays actually, 99% of the clinical data sets are dormant. Nobody's using it. At the same time, we will see that there is it will become a problem for the healthcare provider. So assuming you have 10 years, 15 years of images, okay, what's next? Are we gonna keep storing the data for, I don't know, another 10, 15 years? This is becoming a serious problem or issue for the healthcare providers because it's cost. It's because even maintaining the data, it costs the healthcare providers. I mean, they have annual costs, they have running costs, whether power, whether storage, whether data center, whether network. So storing the data without utilizing it will occur a cost for the healthcare providers. And at the end of the day, although you might not hear it or read about it, like there is still around $4 million a year cost of breaching data. I mean, you might have heard maybe 2 years ago, the biggest story was the NHS in the UK. But trust me, till today, there are still stories that you don't either read about or it's not being announced on the media, where patient data set being exposed to the public network, or whether internet, whether documents. So this is important. So consumption of the data in the right way at the end of the day is really essential for for the governments, healthcare providers, and of course, ministries of health. Now, every time I've been invited to present, right? Especially now we are talking about the hospital of the future. We cannot talk about the hospital of the future without touching the artificial intelligence, right? Everybody's talking about AI nowadays, but we spoke about data, which is the source of the AI. Without data, AI does not exist. I mean, regardless if it's on the industrial side or on the healthcare side. Now, since we are focusing on the healthcare side, definitely clinical data sets are essential to build, train, and implement any AI model. Now, again, I mean, when we talk about AI, let's say, which clinical specialty nowadays is the most department or the most area is the area which is disturbed by or disrupted by AI? Do you think it's radiology? Why? I mean, radiology is a very organized, structured, legalized department or business or section of the healthcare. Now, at the end of the day, the radiologists, I mean, probably the radiology is on the spot because the radiology and the radiologists are the first who adopted AI in healthcare. And the greatest benefit of AI normally happens in the departments or in the areas or in the fields where the highest errors occurred. But is the radiology the department or the medicine specialty where the highest errors occurred? The answer is no. Right? So let me give you an example. For example, a patient is visiting the orthopedic surgeon. Okay? And then even after 1 year, 2 years after the surgery, the patient still have a back pain. It happens. Because there are many risks of errors that might occur during the treatment of the patient, including unnecessary treatments, including surgeries, including medications or hospitalization of the patient. It might take even, like another example, it might take even 2 years to diagnose a patient with depression. When implementing AI in the, we call it narrative-based medicine, where patients, they visit the physicians. Now, normally the appointment with a physician is around 30 minutes. When you take an appointment with your physician, it's 30 minutes. So how much time the physician is spending with you as a patient out of the 30 minutes? 8 to 10, best case. What is the physician doing in parallel? Mobile, IT solutions, hospital information system, radiology information system, web viewing for the images, reports, lab results. So the physician is doing many things in parallel. Okay, and this is actually the area where the highest errors occurred, not in radiology. Because I'm not saying that we have bad physicians, but our physicians are too busy to manage some IT solutions that we put between their hands, and they forgot me as a patient. So a narrative-based medicine with an AI algorithm is capable to analyze the patient's social media, for example, and predict that this patient is a high risk of depression or possible risk of depression, and exactly the AI model is capable to do it exactly, if not better, the same way as the psychiatrist. So at the end of the day, what I want to say here is that there are many other areas outside radiology where we can implement AI to benefit the patient in the first place, to benefit the physicians, and make our physicians to spend more time with the patient rather than spending time with the treating or dealing with IT solutions. Now, we go back to the radiology, and the question is always, do I really need to implement AI in my department? The question is, I mean, before I answer this question, or why I need to implement it, before I answer this question, I mean, AI is an expensive tool, okay? Now, one of the most important thing here is adoption. If you implement and you spend millions of dollars in your radiology department or in your any healthcare department, okay, and you don't have adoption rate higher than 75%, it's like you buy a modality and you are not utilizing it. So utilizing your equipment is exactly like the same as utilization of the healthcare IT solutions, whether AI or other IT solutions available in the hospital. Now, whenever this, I remember very well, like 3 years ago, when the AI, everybody started to talk about AI. So we heard on the news or on the social media that okay, 2, 3 years, 5 years probably down the road, we were gonna eliminate radiologists, which created actually a little bit of friction between technology and radiologists. So somebody is about to lose his job, and I will be replaced by a machine. So this was actually the type of questions that we were getting 2 years ago. Now it's completely different. Now radiologists, they believe in technology. They believe that the AI is here to help, not to replace, okay? And of course, to help them not only increase their productivity and reporting turnaround times, is to as well to increase the clinical throughput. I mean, providing them with first level of diagnosis, that's important. So basically, the AI in radiology are basically in healthcare, specifically in the imaging department, radiology and cardiology, is there to automate manual tasks. So as a radiologist today, I look on the image, okay, there is, I take my measurements, I diagnose using my, because I trained my eye before on how to diagnose based on image, and this is what the AI is doing it for me today. So I'm shortening the time where the radiologists, they have to spend in front of their reporting workstations. So we automate manual tasks. We highlight abnormal or abnormalities on the image. We give them first level of diagnosis. It's not final, so 70, 80% probably, let's call it a preliminary report. And then the radiologists still, they have to use what they trained their eye on and then confirm whether it's accurate, correct, wrong, and then move on. So AI is providing decision support. We are not providing reports. And then, of course, we detect abnormalities or pattern on the images. Here, now, in order to benefit from the AI or artificial intelligence in radiology, the statistics shows that 81% of the radiologists, they prefer to have the AI models or AI applications built in or included as part of their imaging viewer or the PACS. Why is that? Because it's a unified user interface, so they are always used to look at the image the same way, look at the same application. They don't have to learn different viewers or different applications in order to build a proper diagnosis. And of course, as we said before, when I'm sitting on my desk, I'm not losing any time. I have no time wasted moving between workstations, going to the console, going back to the patient, because this will increase the efficiency. reduce the reporting turnaround time, and most importantly, help the healthcare providers to increase revenue. Productivity means revenue and utilization of my equipments. With that, thank you very much. I know it was short, but if you would like to discuss more, I'm happy to take it during the coffee breaks, or we can have one-to-one meetings after the sessions. Thank you very much.
Thank you very much. So we will set up the next speaker's laptop. Meanwhile, Omar is going to take us through the communication and how it brings technology and healthcare together. Omar is the Senior Area Sales Manager for Vocera in the Middle East. And he spent the past 15 years in this region working in the IT industry. And he's strategically looking after Vocera's vision in the Middle East. So Omar, the floor is yours.
Before I start my presentation, I would like to share with you a short story. An incident happened in one of the best hospitals in Lebanon. Unfortunately, this story is a sad story. It's not a happy story. But it's an opportunity for all of us to learn from it. One of the patients has been admitted to the hospital because he was suffering from heart problems. Right? And during the midnight, he was sitting alone in the hospital or in his room, and he felt with pain, chest pain, and he wasn't able to breathe properly. He tried to contact his nurse by using the nurse call system. But unfortunately, as we all know, the nurse call system alert goes to the nurse's station. And at that time, during the midnight, no one was at the nurse's station to take his call. He tried many times, but again with no response. After several minutes, a nurse came to the nurse's station and she found the alert. She ran directly to the patient's room and she found the patient lying on the floor, putting his hand on his chest and telling the nurse, "I have a chest pain, I cannot breathe." The nurse started shouting and asking for help from her colleagues. Unfortunately, no one responded. She left the patient alone in his room, and then she went to the nurse's station again to call the operator and ask the operator to announce code blue. The operator announced the code blue overhead speakers for several times. Unfortunately, two of the code blue team members were sitting together in uncovered area. Definitely, they didn't hear the code blue announcement, and they didn't attend the code blue call. The patient case has been complicated, and during that night, he passed away. Now, let's think about this sad story in a different way. As you all saw, that the main issue was the communication between the patient, the nurse, the operator, and the operator with the code blue team members. What if this hospital was using an advanced, intelligent, integrated communication solution between all the team members and the patient? Right? Let's imagine when the patient pressed on the call button, the alert went to a person, the nurse, and not to a location, the nurse's station. Imagine if the nurse were able to communicate directly with the patient from a hands-free communication device where she will wear and get all the calls from the patients when it's needed. Imagine if the nurse were able to call the operator from the hands-free communication device, right, while she's helping the patient and lifting the patient from the ground, without even leaving the patient on the floor and going outside of the patient's room. Imagine if the operator were able to send one message to the Code Blue team members where he was able to track who received the message, who read the message, who acknowledged the message, and who replied to that message. Imagine if the nurse were able to communicate in 1 second with all the Code Blue team members, by one call from a hands-free communication device, where she will give more information about the patient's situation. She will give them situational awareness so they know what's happening with the patient before they reach or they arrive to the patient room. In case they need help from other teams, they can communicate with other teams at the same moment. Okay, that's fine. Forget about that. So this is how communication bring care team together. And this is how we as Vocera improve the communication between the caregivers. And this is how we improve the quality of care, hospital operation, patient safety, experience, and satisfaction. Vocera Communications is well recognized as the leader in the clinical communication and collaboration solutions. It's based in the US, in the Silicon Valley. Vocera is a publicly traded company where we have more than 1,600 hospitals worldwide using our solution. Let's now talk about the ideal state for how caregivers can deliver safe, efficient, and high quality of care to their patients. As we all know here, nurses, doctors, and other medical staff need accurate information in an instant. And in an ideal state, clinicians share and interpret the information in the same way while using a standard communication platform. In an ideal state, doctors need to access information in order to take the right time, or in order to take the right decisions at the right time. In an ideal state, anyone from the medical staff can reach any other person instantly in order to share and discuss the patient situation with each other. This is the ideal state where most of the healthcare organizations are not being able to deliver. And this is why. Nowadays, data lies on silos, and the interpretation of the data are hindered by many factors, including the need of integrations, algorithms, and communication and collaboration amongst all the caregivers. Communication and collaborations in the hospitals became fragmented, partially because the hospitals are using diverse and multiple communication devices and solutions to communicate between each other. This is impacting, first, the hospital operation, the quality of care, the patient safety and experience. Also, sometimes communication is not happening on time, or it's not happening at all, which impacting the patient's life and threatening their lives. GCI data showed that 80% of the serious injuries and accidental deaths happened in the hospital because of miscommunication or communication inefficiency. This is where Vocera comes to help you in solving all these challenges. What Vocera does and what we do provide to the caregivers is an intelligent, integrated enterprise communication solution for the caregivers to be able to communicate bidirectional voice communication, secure text messaging. When I say secure text messaging, no more WhatsApp, no more sharing information or patient information over the WhatsApp. It's secure text messaging where everything is saved in the servers of the hospitals. As well as we can send alerts and alarms to the appropriate teams. Alerts and alarms are part of the ecosystem because nowadays, most of the technologies, the healthcare technologies, medical devices, EMRs are surrounding the patient. Why the caregivers need to go inside the patient room, or why doctors need to sit on their desk in order to check the critical lab results of certain patients, right? So what we do, we deliver all this information to the caregiver, either to their badges, same as what I'm wearing today. And this is mainly for nurses where they like their hands free to be all the time. So they want their hands to be all free all the time in order to help their patients. And this is antimicrobial, antibacterial badges where we can activate it by voice, like Siri or Alexa. All what you have to do is to say, okay, Vocera, and it will wake up, and then you will be able to call by name, no more numbers, no more extensions. You can call the person by name. You can call the person by role if you don't know what's the name of that person. Or you can broadcast to a group of people in order to communicate with a group of people at the same time. Also, you will be able to send the secure text messages from this badge to any other Vocera users. We have two types of badges, the smart badge and the normal badge, which we have 1 million users using the normal badge. This is for the nurses. What about the doctors? As we all know, doctors prefer to access their emails from the mobile. They like to access the EMR from the mobile. Why don't we give them the opportunity to connect with other caregivers, also from the mobile on a standard unified communication solution? So doctors will be able to communicate from their mobile devices to any other caregiver by who is using either the badge or the mobile device. You might be thinking about the people who are not mobile in the environment, like the admin staff, the pharmacists, the lab technicians. Are they going to be disconnected because they will not be using this or the mobile device? So for those staff, they will be able to communicate by text and voice from a standard web console. They will be able to initiate all the alerts and alarms messages from this web console. To return back to my story, right? Now I think you have a better idea when I said imagine if the patient were able to call the appropriate nurse. The appropriate nurse will receive a call from the badge and it will call back. Imagine if the nurse called the operator who is sitting on his desk and he was able to send a code blue alert from this web console, and he will be able to see who replied or who didn't reply, and he will close the case when everybody replied. This is how Vocera could help you in improving the communication and could help you in bringing the care team together by unifying the communication solution. Thank you very much. We will have a table in the other room, table number 2. If you are more interested to get more information about the solution or how we can improve the operation, the quality of care and patient satisfaction, please let us know. Thank you.
Earlier today, I commented on Dubai's and the UAE's efforts in making this happen. And in fact, launching the world's largest event in a few days. what has seemed to be impossible a few weeks or even months ago. Now I would like to thank the person who sits behind the regulation and sits behind the emergency approval for all the vaccinations that have made that happen after the will of God, of course. His Excellency Dr. Amin Al-Amiri is the Assistant Undersecretary of Public Health Policy and Licensing Sector at the Ministry of Health and Prevention in the UAE. He holds a PhD and Master's in Medical Sciences from the Aberdeen University in Scotland, the UK. And he heads the Drug Department, Public Health Policies Department, the Empowerment and Health Compliance Department, and the Organizational Licenses and Advertisements Department. Thank you, Dr. Amir, for making this among your team possible. I would like to invite you to officially inaugurate the Congress and address the audience. Thank you very much.
Until I will get my presentation. Good morning, ladies and gentlemen. It's my profound honor to be here with you, and also it's my pleasure to welcome you to this beautiful country, the United Arab Emirates. My name is Dr. Amin Al-Amiri. In fact, my title, which was given, is not correct now because we have a lot of changes in the ministry. Now I'm handling, or I'm working as Assistant Undersecretary for Health Regulatory Sector in the United Arab Emirates, which includes the licensing and public health and rest of the departments, as has been explained to you. I'm quite sure that you are so lucky that you are here in this conference, which is being organized for the third time, but you are lucky that it's during the period of Expo. Hopefully you will stay for the people who lives outside this beautiful country, who traveled all the way to the UAE, that you can stay until 30th of September, which it will be the official inauguration of Expo 2020. Ladies and gentlemen, I will start my presentation with a small question. What do you think the most significant element or tools to improve any health services in any of the countries? What's your opinion? What is the most significant tools that could be able to improve the healthcare services in your country? Data, people, change, the budget, relation, technology. All what you have been said is the small tools comes under one major tool. If you have it, then you will succeed. If you will have it, you will have the prosperity. If you will have it, then you can use all those tools, the budget, the AI, the technology, the state-of-art technologies, the health professionals, the talented health professionals enough budgets, all it could be used on a proper way, optimal way, for the improvements of the healthcare services. You should have one very important thing, is the leadership. This is what the Holy Allah, the Holy God gave us. And we as Emiratis are so proud and so lucky that we had leaders, or we have leaders who were able to improve and support us for improvements and through their vision. This was the vision, I can say 30 years back, of Sheikh Zayed, the President of United Arab Emirates, since the independence of UAE in December the 2nd, 1971. He said that the future generation will be living in a world that is completely different, and we should prepare them, and we should make them able to live that world and that improvements. And therefore, his vision and his support enabled us to improve our services and to reach on the highest level. And I'm quite sure you know that there are many countries that are talking about the vision of 2023 or 2027 or 2030. We had a meeting in September 2019 before the COVID in the governmental summit. All of us, all the ministers, all the undersecretaries, all the leaders, all the crown princes, all the presidents, talking about the vision of UAE 2071, 50 years ahead from now. At that meeting, we were thinking how to reach Mars. Now, we are the only Arab country in the world that we had a mission to Mars. And therefore, this led us to talk about the UAE programs and the visions which has been adopted by the government of United Arab Emirates to have the most important tools and pillars here, the best government in the world, the happiness of the community in the world, the most happiness communities. Many of the, or the majority of the countries, you have public relations centers or receptions. No, we have happiness center, community happiness center. Would like to make everyone happy, and therefore we must work so hard in providing the community with the highest level of services. And whenever I say community, not the people who lives in this beautiful country, the United Arab Emirates, also the people who comes as visitors or as a tourist to this country. And you know that the vision of the UAE since last 5 years is that to concentrate on the medical tourism and to make sure that we'll be having more than 1 million tourists as a medical tourism to come and visit the United Arab Emirates. And the best economy in the world and the best education in the world. The highest educated people you have in your country, the more expectation of those people that you will face. And therefore, this will lead you to reach their expectation. And therefore, you need to improve your services to reach the expectation of the educated people who lives in this country. And therefore, the education, it's a must. It is the principle of the vision of the United Arab Emirates for 2071. We are here having a solid national identity. We are trying to have a unified programs, unified laws. At 8:30 today, we had a meeting with the evaluators and inspectors from the PMO to evaluate and manage the Ministry of Health and Prevention. We had a meeting for half an hour with our minister and the inspectors. We had 11 inspectors from all over the world. I did a presentation talking about how UAE succeeded in unifying the healthcare services, the laws, the regulations, and how succeeded to improve the services and to attract the most eminent hospitals in the world. We have Cleveland, Abu Dhabi. We have Seoul National University Hospital, which they managed, Sheikh Khalifa Hospital in Ras Al Khaimah. We had Global Health, which they used to manage Sheikh Khalifa in Ajman, Al Giwain, and also Masfoud Hospital and Rashid Diabetic Center. We have Mayo Clinic, which they have affiliation with American Hospital in Dubai. We have a huge number of international, most eminent international hospitals. They are managing the healthcare services with us. I do remember 5 years back, I used to say that the distribution of the healthcare services distributed in the country, 54% through the government, and almost the rest, which was 46% from the private sector. Today it's completely the opposite. 65% is from the private sector, and almost the remaining 35% from the government. And this is a good support to the strategic partnership with the private sector, and how we were able to attract the most international and private sector hospitals to come and join us. Not only the general hospitals, but also the specialized hospital. In 2019, we started the first program of organ transplant from the cadavers, deceased donors. Now we had 132 deceased donors. We were the first, the history of UAE started to do heart transplants. So far we had 9 heart transplants. We had 12 liver transplants from the deceased donors, and we have hundreds of kidney, lung, and rest of the organs. I'm not talking about living donors, which we can't take liver. We had huge number of liver donation from living donors, and we had from kidney donors. But we are talking about deceased donors. It's an ongoing programs. And therefore, having said that, we have Emirates Medical Council, which is chaired by His Excellency, the Minister of Health. This is a unique model. I wanted to share it with you here. It consists, the Emirates Medical Council consists of Ministry of Health and Prevention, Dubai Health Authority, Abu Dhabi Department of Health, Sharjah Health Authority, Dubai Healthcare City, and the healthcare services at Armed Force, healthcare services at military, and we have EHS, which is a spin-off of the Ministry of Health, Emirates Health Services, and we have 3 members from the private sector. Why the private sector? 3 rather than we have 1 member of rest of the governmental institutes, because we want to support the strategic partnership with the private sector and to bring in the most eminent international pharma and medical company to the UAE and to be the best by 2071. As an outcome of the vision of the government and the rules of the different health authorities under the leadership of the Emirates Medical Council, it came a significant positive impact on the community. Let me share with you just one slide to show you that the UAE healthcare market size includes pharma and medical, which is health expenditure and pharma expenditure in the UAE. We reached by 2021 $20.8 billion US, and it has been forecasted to reach by 2025 $26.8 billion US, almost increment of close to more than 20%. And this is really significant improvements at the healthcare services. Now the improvements at the level of the health expenditure, it do reflects how much we are spending on supporting the healthcare services and how much the healthcare services are expanding in number of the hospitals, health centers, and also the specialized centers and clinics at the level of UAE. An outcome of it, that we had huge increments from 18 to 20% in number of the talented doctors. This is only MOHAB, despite Abu Dhabi and Dubai, Sharjah Health Authority, and Presidential Office, by the way, which they run 4 hospitals at the level of the UAE. We have the huge number of the other medical professionals like nurses, health professionals, the nurses are alone, and allied health staff, despite, the pharmacists at the level of the United Arab Emirates. Now, it was so difficult for many of the countries until today, by beginning of 2020 until now, 2021, to implement the highest technology due to the COVID pandemic situation. But we were the best country in the world that we were able to introduce the highest technology, convert those technology, either AI, wearable items, new technologies, to be used to support our community and to protect them while they're at home or at their offices, provide them with healthcare services, their medication, their treatment, their checkup, and not allow them come to our hospitals. And among those technologies are the telehealth, which is, I do remember the first telemedicine started in UAE. What do you think? It was in 2000, 2005, 2010. It was in 1993. I do remember I was responsible with a professor called Professor Gora, the cardiologist who used to come from Mayo Clinic, Rochester, in the United States of America. We started in Al-Mafraq Hospital, the first telemedicine in United Arab Emirates, maybe in the region, 1993. And I was the coordinator with Professor Gora. I was at that time managing the medical laboratories and blood transfusion services. By the way, my professionality is blood transfusion medicine. And therefore, telehealth is one of the leading aspects which is being used so strongly in the UAE. We have a robotic surgery. We were the 4th country in the world to bring Da Vinci in Al-Qasimi Hospital, Sharjah, for the open heart surgery and the radiology. I'm quite sure you know that Da Vinci is a robotic technology. Wearable items, now it's being used widely, like watches. You can define, even check the ECG of the patients. You can check their blood pressure, their pulse, and it is directly connected to his physician at his clinic. No need to come, the patient to go forward to the hospitals. We can control him while he's at home and provide him with the changes in medication or recall him for emergency to the hospitals. We have smart hospitals. In some of our hospitals, we have smart hospitals that for the newborns, we manage with Washington University Hospital, that we take the image of the face and we can recognize if this newborn baby exposed to any of the hereditary or genetic diseases, and immediately we give him a medication. 17 cases has been defined so far, protected by the help of Allah, help of God, that we protected them from not to convert to have a genetic disease in the UAE so far. The blockchain, now all of our systems is under the blockchain program. I don't want to go into the details, but let me talk about the data and the artificial intelligence. The representative from GE said, for last 2 years, the AI was introduced in the radiology. I will say for last 3 years in the UAE, I remember where the minister, His Excellency, the Minister of Artificial Intelligence, Dr. Al-Ulama, we introduced the first AI technology on reading the chest X-ray for the newcomers to the UAE. Automatically, it will be read by AI, and then the reports will be forwarded to the physicians, and no need the physicians even to see the patient. It will be done electronically by distance, and therefore we minimize the number of the radiologists working in our centers. We were again the first country to have the data protection law 2015, and it has been updated in 2019, that all the data protected, and now we are working with the international companies that the data will be protected at the web, based in the UAE, not based in any of the other countries outside the UAE, to make sure that data will be protected. For sure, personalized medication, it is into the system in the UAE, and many others which we are working so hard. This has been needed a support to our patients in the UAE, and this support, in fact, are many. The patient had an access to most innovative drugs. I'm quite sure you know that UAE is the only country in the region that we issued 8 emergency authorization use for 8 different number of the vaccines. All the vaccines is being used in the world. It's used and provided in the Emirates, Pfizer, Moderna, Sinopharm, Hayat, which is the spin-off of Sinopharm produced in the UAE between Sinopharm and Julfar. And we have Sinovac, also registered in the UAE. And we have AstraZeneca, Johnson & Johnson, all has been registered in UAE, and there is on pipeline, Consino, and some others are on the pipeline. We have the highest number of vaccines registered in the UAE as the first country in the region. Despite that, we are the second fastest country in the world in registering of the most innovative drugs as soon as being approved by FDA in the state or EMA in Europe. It will be registered, not only registered, provided to the patients and enrolled on the insurance program. I will give you just one example. During the COVID-19 situation, Cetrovimab from GSK, we were the second country in the world to provide this medication to the patients in the UAE, and this needed also the people from the neighboring countries to come and take their medication here once we discovered that they are in need of the medication and was sent back to them. We minimized the cost by using the high technology and AI. You were able to minimize the cost. And also the patients have then access for early diagnosis. As I said, I gave you just one example. We have a huge number of examples, and we will be able to protect their health, to provide them with the best quality of care and the cure of their diseases, and management of the chronic and non-chronic diseases, and management of the best standards of well-being, mental health, which is one of the leading aspects now that the WHO, and the well-being, which we have a policy for the well-being. Despite that, we have a policy for mental health, which was released a couple of months back. Having said that, this is a sort of enhancement of the efficiency for the healthcare services at the level of the United Arab Emirates. The plan for Vision of 2071, there are a huge number of elements, or I can say tools, which was taken. Those are the tools which was taken by the Ministry of Health and Prevention with our strategic partners, health authorities, and the Armed Force, Ministry of Interior, and the private sector, with the Emirates Health Services, talking about the a healthy and active community, how to be able to put the prevention care programs, the well-being, the healthy lifestyle, management of the biological and genetic medicine, leading facilities. Now we are producing biological drugs since long time. We started to produce vaccines. Now in the pipeline, there are 3 more vaccines is under the negotiation to be produced in the UAE. Mental health is very important. Now each single hospital, by force, it has to be established a mental health clinic at each single private and governmental hospital, and even among our health centers. If I will talk about the R&D, research and development, encouragement of research and development, and using of big data information to be converted into the solutions, and how to do the studies and to make sure that we'll be able to help the country in preventing different type of communicable or even mainly the non-communicable diseases. I'm quite sure you know that economical burden of non-communicable diseases, NCDs, has been stated in 2015 by the United Nations was $863 billion, expected to reach by 2023, $1,023 billion. Here comes the importance of controlling the NCDs at each single country, and how we are strong in providing the standards, policies to control the NCDs. We are thinking of the expanding on personalized medicine, advanced digital technology, and empowerments of our patients, and to make sure that the patient's right has been protected well. And we always look forward to study what is the need of our patients, what is their expectation, what is I can say, their plan, and how to reach them while they are at home rather than to bring them to our hospitals. There are many others, public health vigilance and healthy environment. The occupational health also is being given a strong policy and control. Ladies and gentlemen, I will go back to the first question which I asked you, that what is the most important, I can say, tools to support the improvements of your healthcare services in your country. And as I said, the leaders. If you have the visionary leader that could support your country, will lead you for the prosperity and the success. I will end my slide by a statement of His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister, ruler of Dubai. I'll do the translation. He said, "We learned the strength is on unity, and therefore we are the most united country, and we have unification programs in the UAE and health sector and on the rest of the services. And the happiness is with the family, and therefore it's very important that we control the happiness of the families by providing them the highest quality of care, education, healthcare services, and also the proper environment that they can live in, and their housing, the rest of the services, to provide them on the fastest way and highest quality." And then he said, the success by giving, and you know that we have huge number of the charities, and UAE was on the top of the countries worldwide in giving as a charities to the needy countries, also to the other countries. And believe it or not, during the COVID pandemic situation, from beginning, I can say starting from March 2020 until today, the majority of the countries worldwide suffered from shortage of drugs, PPEs, sanitizers, many things. UAE completely were the opposite. I swear for God, I'm the responsible of the pharma industry in the UAE. We were able to provide 41 countries medicines, PPE, sanitizers from the government of United Arab Emirates. 41 countries until today. We are #1 worldwide. And finally, I will say that the vision of the government is to concentrate on the youth. And if you have a strong, the most strongest base, or I can say pillar of each single country is the young generation. If you have to invest on them, and you have to provide them with the highest quality of education, highest quality of healthcare services, and the proper environment that they can live healthy with happiness. And therefore, Sheikh Mohammed said here, you cannot reach Mars unless if you will concentrate on your youth, you educate them, you support them, and you lead them to think for the future of this beautiful country, the United Arab Emirates. Thank you very much.
Thank you very much, Your Excellency, Dr. Amin Amiri. So, Dr. Amir would like to take any questions if you have in the audience, and let's open up a Q&A session. So if you have questions, please raise your hand and a mic will fall on you. Yeah, we have a question there on this table. Can we have a mic there, please? Doctor, will you back to me?
Thank you for a very enlightening presentation. In your market sizing for the spending on healthcare, medicine, etc., what percentage is medical tourism? Medical tourism in Dubai was something that we were focused on growing, and I just wanted to know how is it growing and what percentage of that number is it? Thank you.
I don't have an exact figure for out of 20.8 billion US dollar was medical tourism, but I can give you the figures and number of the visitors, which was planned and achieved by just one city, Dubai. There was the plan of Dubai Health Authority, I believe in 2019, that they wanted to reach 500,000 visitors as a medical tourism by 2019. And I'm quite sure they reached more than that. Now we have huge number of patients, they are coming to the rest of the hospitals. I'm in contact with majority of the private hospitals at the level of the country. I knew that Rak Hospital in Ras Al Khaimah, they have contracts with more than 4 African governments, and they are receiving thousands of patients every year, thousands of patients. I knew that from the Tombe group, because they have some of the hospitals being established in Tanzania or rest of the countries. They have also a program that they bring the patients from there to their hospitals based either in Ajman or Sharjah or in Dubai. I do visit Cleveland, Abu Dhabi so frequently, and I found that a few number of patients that are coming from the neighboring country for their treatment, the complicated cases, to Cleveland Clinic, because Cleveland Clinic is the most advanced hospital. The majority are advanced in the UAE, but Cleveland is unique because we have an organ transplant program for 6 organs. We have, by the way, 8 hospitals approved for organ transplant. Cleveland, Abu Dhabi, Sheikh Khalifa Hospital, Abu Dhabi for kidney, Cleveland for 6 organs. And we have Dubai Hospital, Al Rashid Hospital for kidney, And we have City Hospital, private hospital in Dubai for adults kidney, Al Jalila for pediatric kidney, Al Qasimi Hospital and Fujairah for adults kidney, which it means that the number is increasing. I do apologize that I don't have an exact figure in budget out of 20.8 billion, but it's increasing rapidly. Thank you. You know, the tourists, they don't need only to visit the places and to get use of the health services at that country, like what's happening in some of the Far East, but they need quality of care. Therefore, we have state-of-art hospitals, technologies, AI, the medicines, which is the most innovative medicines that the patients have an access to it. They have an access to it here, they don't have an access to it while they are in their own country. And therefore, they prefer to come here and to take their medication and go back home safely to their country.
Thank you very much, Your Excellency, for the presentation. As usual, it's very insightful, inspirational, and informative. My name is Dr. Muhaymin. I'm the Chief Executive at the Nat Al Amarat Hospital in Abu Dhabi. And I would like to touch upon one of the areas you focused as a part of the future policy of mental health. And I think we need some more elaboration. Will that be part of the standard practice across all healthcare settings, including hospitals, primary care, or what's the policy moving forward with mental health, especially after what we have seen during COVID from the levels of rising stress, the need for further advancement on mental health programs in the UAE. So would you please elaborate on the future program or policy regarding mental health in the UAE?
I think I can split your question into two sections. Number one, the mental health. Now, we had twice the improvements on the mental health policy. And the recent mental health policy, as I said earlier, was published a couple of months back. And the policy was published by the PMO, which is His Excellency, His Highness the Prime Minister Office. And therefore, it's now compulsory at each single hospitals and health centers, the mental health to be provided and to be concentrated. And we have a sort of KPIs in controlling the mental health programs in different governmental and the private hospitals. But I think there was one of the issues, which was, I think it's a part of your second question, is that during the COVID or during the pandemic situation, the movements of the, I can say the physicians or the health professionals supporting mental health, mainly during the pandemic situations. I do remember I released the decree or as a circular, it was in August 2020, to allow the movements of the health professionals all over the country without any borders. And now we are working on unified license. You know that we have unified, while you are working in the UAE, we have a unified exam and evaluation, which is called PQR, Professional Qualification Requirements, released in 2016, August 2016. Today we are working in something which is not for publication. Hopefully no one from the media will be here. We are working on something, I think, I don't want to release this. We are working on something that you will be able to move all over the country with your own license, which is done in Abu Dhabi. And therefore, we released the circular, as I said, in August 2020 to allow mainly the health professionals at the field of mental health to move all over the country, and also the surgeons, and to move with their patients if the patient will be transferred from Abu Dhabi to Dubai, or Dubai to Abu Dhabi, or Ras Al Khaimah to Dubai. Movements of the health professionals without any border, without any sort of licensing, to have a unified program for the, and we are working now to be this official. So we will start with the doctors, but later on we will go into the rest of the specialties like pathologists or the radiologists. But mental health program has been added to the national agenda of the United Arab Emirates, and also there are Ministry of Interior working with us concerning the mental health, because we have also to think of the other part of the subject of the mental health, like drug addicts or addiction to the other. By the way, addiction is not only to the narcotics, addiction is to many things, alcohol, even addiction to the software in your computer or to your mobile. And therefore, we are trying to study those things with the Ministry of Interior. And I'm a member in a board called Supreme National Narcotic Board with His Excellency Dahi Khalfan. And we are working on that very strongly at the level of UAE to combine the efforts between Ministry of Education, Ministry of Interior, and also the Ministry of Health and Prevention with the rest of the authorities. Thank you. No more questions? Thank you. Thank you very much.
Thank you very much, Your Excellency, Dr. Amin Amiri. Countries spend trillions of dollars on protecting their borders. However, there are invisible borders, and investing in healthcare is investing in protecting the invisible borders against pandemics and communicable diseases. In our next panel, we're going to talk about how has the investment been before COVID-19 hit us, and how has it changed after COVID-19? What are the opportunities? And why is healthcare always lagging behind when it comes to investing upfront? And that is going to be discussed by Dr. Sara Adella. Dr. Sara holds 2 masters from 2 of the world's most renowned universities, the Royal College of Surgeons in Ireland and the London School of Economics. And she will be leading a panel with amazing speakers as well. So there's Bassem Muftah, who's the general partner from Global Ventures. There's Dr. Mohammed Hamadi, who is the CEO of Amanat Holding. Dr. Sarper Tamli, who is the operating partner of TBM Capital. And Walid Mansour, who is the partner in Middle East Ventures. Please join us in welcoming Dr. Sara Adella. Thank you very much.
Thank you. Hello. COVID victim.
It can make you speak freely.
His Excellency Dr. Amin Amiri for joining us today. Please join us in a round of applause. Thank you very much.
Good morning, everyone. Thank you for the kind introduction. And we are so glad to have you all today with us in this panel discussion and to discuss further about how can healthcare investment and healthcare disruptors Congress can further this discussion further. My name is Dr. Sara Al-Dallal, and I'm here joined with 4 gentlemen. So if these gentlemen would start by introducing themselves, and we will start from there onwards discussing about healthcare investment and how it will look like in the near future.
To turn it on. Good morning, everybody, and thank you for having us here. Thank you, Dr. Sara, for hosting this panel. My name is Bassem Muftah. I'm a general partner with Global Ventures. It's a UAE-based VC fund that invests across Middle East and Africa in a number of sectors, so we're generalists by nature. But our latest fund, Fund 2, has been dedicated half of it to health tech and digital health at large. So happen to know many of these gentlemen, work with them on many great investments and the growing ecosystem of technology in the region.
Nice to meet you.
Thank you. Good morning, everybody. My name is Sarper Tamli. I wear a couple of different hats, but I am an operating partner in TVM Capital Healthcare, which is a private equity firm based in UAE and for the region, been around for 10 years. And so we look at from the private equity side of things and only invest in healthcare for the region. I'm also founder and managing director of Diginova Health Solutions in investing in digital health specifically, and also developing an elderly care facilities in the region, and I'm managing director of Vita Healthcare.
Good morning, everyone. My name is Mohammed Ahmadi. I'm the chief executive of Amanat Holdings. Amanat is a publicly listed company in Dubai financial market. We manage around $1 billion in healthcare and education. In the region, we're currently invested in Saudi, UAE, and Bahrain. However, we do focus on the wider MENA region. We haven't invested in technology yet. We're taking a look at it, but not yet. Pleased to be with you.
Thank you for the invitation, and I'm very pleased and honored to be here with you. My name is Walid Mansour. I'm a partner at Middle East Venture Partners, and for the past 12 years I've been a venture capitalist focused on technology investments at large in the MENA region, out of the UAE, but covering the broader MENA region in the areas of tech and internet in general, including healthcare. So thank you for the invitation.
Thanks everyone for the introductions. So before starting and discussing what are the needs and opportunities that we are coming across in this era and in this region, but we'd like to start, start with a general question. How does from your own perspective, respected panelists, you think or you can define from your own place, what does a proper or a healthcare investment should look like? It's a broad question, I know, but yes, because you're looking at health education, so it might look at something different, maybe different than the technology investors.
Happy to start. From our perspective, we believe that healthcare investments should be focused on platforms that are diversified geographically in order to be able to bridge a gap in the market. I'll be more specific. In this market, His Excellency has talked about how the UAE is advanced and has taken a leadership position, really in attracting talent and building facilities and manufacturing vaccines, which is all accurate. Where I think we still have an opportunity to participate as a private sector is in focusing on medical specialties, in making sure patients stay in the country to be treated for tertiary and quaternary diseases or conditions. And as such, healthcare platforms are able to bridge such a gap. Because if you have a network of hospitals focused on a specialty, you will be able to attract top talent into your network. And you would be able to provide volumes of patients that are sufficient enough for the quality of healthcare to be maintained at the highest standards. And as such, at Amanat, we're currently invested in long-term care and rehabilitation as a core vertical. We own the largest network in the region for LTC, post-acute care, as well as mother and child and fertility is another vertical we're focused on. So this is how we view the future of brick and mortar investments at the very least in healthcare.
Thank you, Dr. Hamad. Please, Dr. Saad.
I'll continue. So maybe from the little bit of private equity point of view, because as I said, we only invest in healthcare, but we obviously take investors' funds to be able to deploy and make growth returns and overall. So the interesting journey starts with convincing actually the investors that not really ever invest in healthcare. Because healthcare itself is an impact investment. So I think it's very important for us to look at, when we invest in healthcare, what kind of impact further, not only in healthcare, but further how we can create impact in the communities. And the other thing is important for us that now more and more investors looking globally in environmental, social governance piece. So how, if none exists in a company that we will invest, how we can create that within that company, how we can grow that company. Of course, scalability and as well as the geographical expansion is critical, but it's not really necessarily, it could be in the only one country, and within that country you can grow and then do and create the impact overall. So that's what I think the approach that will come into. I will not go to details, but high-level strategy, I will say that.
Thank you, Dr. Sarper.
Well, I can add a technology perspective if that's helpful. I think ultimately, as technology investors, there's maybe a slightly different framework that we use. We look at 3 layers, infrastructure, software, and content, if you like. Infrastructure are the tools needed to fill the gaps that maybe traditional healthcare investors cannot solve for. So access to a wider group of people or users in places like Egypt or maybe even Saudi become interesting. Telemedicine being an infrastructure play that allows certain groups or certain segments of society to be able to access quality healthcare at an affordable price that maybe they couldn't afford through directly walking into a hospital. On the software side, I think we look at softwares that save money or improve the revenue generation of the healthcare system. So that could be on the insurance side, that could be on the practice management side, but there's a bunch of different softwares in clinics, different types of specialties, etc., radiology, there's a whole bunch of areas. And then on the content side, we think about two key, if you like, groups. One is the consumer having access to content, especially in the region. Arabic content is really lacking, and having, and we share an investment with Walid on Al-Tibbi, having access to Arabic content that can be trusted, where people can read and understand and make their own choices, because consumers want to make those choices, and hopefully they're not going to rogue websites with misinformation on them, but rather something like that is important. There's also content for the doctor, right? And the content for the doctor, or for the practitioners, I should say, at large is also important. Staying up to date, difficulty now with COVID to have continued medical education, and being able to bring that through the internet or through online platforms has also been something exciting that we've worked with Dr. Sarper on here for the region.
Thank you, Mr. Bassel. How about you, Mr. Walid? We'd like to hear from you.
I think a lot has been said. What I would like maybe to shed some light on is what are the digital and technology opportunities of the future may look like. And the theme of the conference is artificial intelligence. And I think we reached a point where we can start investing, scouting, building those type of applications and solutions, because the usage of data today is democratized for those who know how to mine it properly. And healthcare is a perfect vertical where the applications of artificial intelligence or big data applications are ready, because we have the data sets, we have the distribution channels, whether they're digital or non-digital, we have the consumer adoption. And COVID was an amazing case study on AI applications when it came to tracking and when it came to prevention and when it came. So my point is the consumer is now ready and acceptant of such applications. So I think the next years focusing on the data opportunity in healthcare that across the entire value chain, whether you're delivering from a pharmacy to the home, or you're at the diagnosis, and we had a great case study about radiology before and use of data there, and anything in between, we will create tens and tens of technology companies that today are going to start as startups, but 5-10 years down the line are going to be established platforms, I think we started that journey already, and I think the Middle East, UAE in particular, has the talent and has the depth of understanding and the capital and the knowledge to accelerate this AI healthcare journey.
Thank you, Mr. Walid. Picking up from the topic that you just mentioned about AI and COVID being a good case study, if we might say, that data was taken into consideration for tracking, implementation, policy shaping, and decision making. So if I can take you, if I can put you all, and put even the audience with us today, to 2 years back, before all of this, before all our masks were on our faces, and before we are social distancing, how do you think back then, as all of you being in the realm of investment, healthcare investment looked like 2 years ago, pre-pandemic, and how is it looking now? And what are the needs besides the AI? In which areas do you think AI, technology, education, the consumer, the customer would look at? So the floor is yours. Who will take the first question? Dr. Safar?
I'll start, okay. So very interesting. Thanks for the questions. Of course, what we were looking at 2 years ago definitely changed what we're looking today, that's for sure. We were always looking into more specialized care areas in the service side in terms of very specialist like long-term care, home care, and mental health, but they are not always available, the companies, to really invest into it. So sometimes even you have to go to create, as Mohammed said, create a platform for that specific area to be able to grow it. We were looking at from that angle. Of course, the manufacturing comes in the region, a very important area now as well. But within 2 years, when almost every service provider had to jump into some form of teleconsultation, and then started having great impact and growing local companies to invest in more into, through the incubators, accelerators supported by the government, more and more companies coming to the market, then we started looking very differently. So then the question, though, again, from the not venture capitalists, but the private equity hats, what is the real economy that these companies can create? So what that means that the entire ecosystem in the country that we are looking at is the reimbursement and the really adaptation of that new technology, anything digital, could be used in the hospital in every department, can really create a real economy. So that's why we're looking at that now. The companies can create that impact, again, going back to impact, but companies that can be adopted by the all hospital providers. So what our fear now, and my fear now exactly, so each hospital jumped onto this, for us to do teleconsultation, insurance is paying for it, but did they really adopt it? Did they really transform their practice? Are they really going to understand that this is not a short-term solution to their entire care provision, but rather than this is here to stay? They need to change their provision of care, stop looking at the primary, secondary, tertiary approach, look into, I think you mentioned from Estonia earlier, like proactive care. So any company that kind of goes into that place, that creates the support to the providers and healthcare services will be very interesting to us now. And also you mentioned AI, and also, I mean, for us to be able to create that digital platforms, we need to have companies more in the AI space, technology, blockchain. Those companies are big interest to us.
Great, that's a great point, yes, it is.
The metaphor that we use a lot at Global Ventures is the one to compare the COVID crisis to the 2008 financial crisis, right? In which the banking sector went through, as I'm sure many people remember, or the globe went through a pretty big situation, banks failing and the contagion, if you like, of one system failing or one bank failing and on the rest of the world. What's important from that history lesson is to look at what happened, what was the attitude before and then after that crisis. So before, banks and institutions, large ones, were ignoring fintechs, if you like, and treating them as though they were the enemy, right? And treating them as though somehow they were taking their pie, not realizing that ultimately the consumer is the one who is in charge of their finances and has choices to make. The regulator in 2008 obviously came in very heavily handed and said, and changed the rules of the game, including open banking, including data exchanges, and all of the things that allowed fintechs to flourish further and to move further. I'm not going to dwell on it more. I think many people have lived through that and know the perils, but the story being that a crisis leads to a huge amount of opportunity, that it is not digital health versus hospitals or hospital groups, that the regulator does have a very important role to opening up the system for the consumer's benefit ultimately, to allowing the end user to decide what they want to do with their health and how they want to take that journey, and to improving healthcare just overall for everybody. Today, I don't think many people will remember themselves visiting a bank anytime recently. That's good. Many people will not remember, that the amount of options you have just through your phone to be able to, make choices and decisions on your finance should be the parallel to which healthcare needs to strive for.
Thank you. That's a great point. How about you, Dr. Hamad? If you can tell us, what do you think with the education and the platforms that Dr. Saber have said, and expanding with the telehealth and the AI, how would you look at investments or how things were 2 years ago, and how do you think things are moving towards, with the telehealth being in the minds of most of the people as a short-term thing and not the future? How do you think things will move forward?
Let me be the devil's advocate here for a second. I think there's a pre-COVID where everyone thought technology is a bit far-fetched to be achieved or at least implemented. We knew it existed, but its adoption was questionable. There's during COVID where we thought the machine is the solution and the hospital is the phone. And then there's reality, which I think where we are today. And reality in our view is, yes, healthcare is disrupting the way we deliver healthcare across the value chain. But the gentleman mentioned two very important points, which is adoption of the end user, be it the patient, but also of the physicians. So I think where really technology will continue to play a role moving forward is when it comes to AI, when it comes to systems and tools that are smart, that are efficient, that allow us to move more into predictive medicine rather than only curative and reactive medicine in the future. But at the end of the day, the requirement for a physical presence of a brick and mortar hospital and a doctor and a physician and a nurse to provide healthcare will be a necessity. So technology will never replace healthcare as we know it. I think it will complement it, will make it more productive, more efficient, smarter, providing a better quality healthcare, providing access to a wider patient pool at a lower cost to the government and to the insurance companies, but it's not a full replacement.
Thank you, Dr. Hamada. How about you, Mr. Walid, if you'd like to add something?
Sure. I don't think anyone is arguing that a machine will replace humanity anytime soon. So that's out of the question. What machines do, they help humans do a better job. But when it comes to, but I personally bet on trends. And there's specifically two types of trends to watch out for when it comes to data adoption in the healthcare industry. There's one, to what extent there's an upgrade in the distribution networks, and a hospital is a node in a distribution network. A pharmacy is a node, and people kind of connect those nodes. So to what extent those trends are going to, those networks are not going to be upgraded, mutated, changed. And the second trend I like to bet on is what we call consumer trend, but in this case probably we should call it something else, maybe patient's trend. And I'll give you an example, speaking about mental wellness and mental health. You know that the fastest growing technology companies now, and I'm talking globally, are the ones that provide mental healthness through Facebook channels or through group channels or even to WhatsApp. So you have a trend where the patient doesn't want to visit a therapist. He just wants or she wants a quick advice on the go, a quick discussion from the mobile at midnight at $1 through Facebook. That's a trend. You can, nobody knows what the future is going to look like, but you cannot ignore that 3-5 years ago that did not exist, and today you have a new generation coming up and feeling comfortable this way. Is it the TikTok generation? I don't know. Is it the, is it social media definitely played a role in kind of producing that trend? But this is an example of how the actual network upgraded. So yeah, that's the only thing. But I don't believe that machines will replace doctors or humans anytime soon. I think we're safe on this side.
Thank you, Mr. Walid. I mean, as we have heard, there is still a human touch for the medical care and the healthcare. And at the end of the day, a healthcare should not be focused on curative or even predictive. We need to look at the well-being of the society and providing solutions where it becomes consumer-friendly. We would like to wrap up now the session, but before we wrap up the session, I would love to hear 1 to 2 words or 1 to 2 sentences from each respected panelist here regarding how do you see healthcare in the next 5 years?
Okay, I'll give it a shot. 1 to 2 sentences? Am I
Yes.
done? Those were the 1 to 2 sentences.
No.
Apologies. I think as we talk about this sector in specific, we need to also think about the education side of this. I think it's the part that gets overlooked. Investing in R&D, research, fundamentals, universities, programs, and so on is the key to it, whether it's on the technology side or on the practitioner side. That's just one thing that I wanted to make sure to say, that it's not just about what's the coolest, latest thing. It's making sure we have capacity for the future to compete.
Thank you. That's a great thing to add. Dr. Sarper.
Well, maybe my wish for next 5 years, I don't know if you're going to be there or not, but let me tell you my wish for next 5 years. Because we're in the Healthcare Disruptors Conference, so maybe then look into what will really disrupt the healthcare in the next 5 years is the critical to me in all ways. I mentioned that we are trained to look at the healthcare since 30 years ago when I went to the healthcare management school. Primary care, secondary care, tertiary care, quaternary care, aftercare, and you die. And then we start seeing circles of all of these around, but never been realized. So with the digital technology, that the accessibility to healthcare, and then redefinition of healthcare, adding the wellness, emotional, physical, mental well-being is very critical. So when we talk about creating platforms, we should look into problems in the country, the cancer, cardiology, the heart disease, and all of those, and then how we can create those platforms with all the connectivities around, from schools, from the retail pharmacies, the workplace, then the physician, wherever we connect the physician, doesn't matter, in a primary or secondary care. So that's the disruption that we can create, and then the creation of that will be with digital technology. And for that, the management of the healthcare, wherever they are, in a medtech, health tech services, they need to be digitally adapted themselves.
Thank you, Dr. Sarper. We are looking forward for this unified platform. Dr. Hamade.
That's also the wish list. I think healthcare will become smarter, more specialized, with more accountability, leading to healthier and happier societies.
Thank you for the short 2 sentences. Dr. Walid, Mr. Walid, the final words are for yours.
Unfortunately. It's a very difficult question. I can barely predict my weekend, so let alone predict 5 years from now. But what I'm confident about, and having seen this in many industries, is that digital disruption changes not only the patient and provider landscape, but it also comes from people who are not incumbents. So, and this is a key element in investing into this, into any digital disruption. I'm going to give a parallel with what's going on, and there's an economist article on that. If you look at the German car industry today, and as an example of a brick and mortar industrial brand, 100 years old industry, how it has been almost left behind because of the lack of investments, in Germany in its digital infrastructure, and you have, next generation of companies that are really, racing to displace some of the old kings there. What I can bet the house on in the coming 5 years is that disruption is not going to come from the incumbents, right? It's going to come from those who live at the periphery, those who observe trends, bet on trends, etc., and they're going to pull back the incumbents into their world. And that's how digital transformation, digital disruption has worked in every vertical, starting from retail 30 years ago up to today. So at least I can safely, or at least believe that.
Thank you, Mr. Walid. Let's wait for those peripheries and for everybody to be change agents. Let's call them change agents to really push the healthcare towards its really premise and goal of having well-being, a state of well-being. Thank you all for joining us today in this panel discussion. And please remember us all a year from now in the 4th Annual Healthcare Disruptor Congress. And probably the things that we discussed in 5 years could be done by next year. Thank you, everyone. And stay tuned. There's, I think, a coffee break right now? Yes. Then thank you, everyone, for tuning in today with us from the online platform. And thank you for all the attendees today for listening to us.
Thank you, Dr. Sarah, and thanks to all the panelists. Among those four, there's billions of dollars moving, so make sure you speak to them afterwards. All right, so the next panel, and we're going to push the coffee break to a longer break after this session. Our next panel is a special panel because it's a topic that we've been discussing for many years, and I think with the pandemic and with everything we've said, it's now the right time to discuss it even further. The integral part of any healthcare system is the physician. And physicians have been faced with so many challenges over the past years. Physicians of today need to know technology, they need to know empathy, they need to know medicine, they need to know diagnosis, and an awful lot of things. It's really interesting to know that physicians are not being prepared well for that. And to discuss this further, we have Dr. Amanda Nyman-Peters. Dr. Amanda is a professor of behavioral sciences and leadership development, and she holds a PhD from Cambridge University. She works as a professor, and she's the former dean of HALT International Business School in the Dubai campus. And here's a spoiler. She's publishing her first book next year, so make sure you grab a card, maybe you get a free copy and the signature afterwards, and it's going to be published by Bloomsbury Business in 2022. The last thing I would say before introducing Dr. Amanda to the stage is, I have seen many people talk about education, but among many people I've seen, Dr. Amanda has been one of the few people who was able to strike a balance between industry, between creating results, and teaching and preparing future generations to be those people. Dr. Amanda, the floor is yours. Thank you very much.
Gosh, that's extremely kind, Ahmed, and I have to say that you were one of the best students that I ever had. So I would like to introduce my panel, and as I say their names, if they could make their way up here and perhaps give the audience a little wave. The first person on my panel is Professor Hossam Hamdi. Professor Hossam is the Chancellor at Gulf Medical University in Ajman, and he is a world-renowned expert in futuristic medical education. He recently won an award for innovation learning technology, and we're all looking forward to hearing more from him. Thank you for joining us, Professor Hossam. Next on the panel today is Dr. Saba Habibullah. Dr. Saba is a clinical scientist in genetics. She did her PhD at Newcastle University, and she has numerous other degrees as well as a distinguished research record. Today, she's the head of education, development, and quality improvement at the Iranian Hospital in Dubai. Welcome, Dr. Saba. And also on our panel today is Dr. Fatah Mehmet Gul. He is the Chief Executive Officer of Faqih University at Dubai Silicon Oasis. He is also an experienced clinician and academic. Are you with us today, Dr. Fatah? Okay, apparently not. All right, our discussion today focuses on the fact that physicians are key players in meeting the future healthcare needs of any society. As we have seen over the past 2 years, our interconnected global society will continue to face unprecedented and unpredicted challenges. Yet our traditional education systems that are based on lectures and laboratories are fundamentally unsuited for simulating complex multivariate challenges. In my own field of teaching and research, that is leadership development, we face similar challenges. You can't develop leaders by simply talking about leadership, and throwing people in the deep end to see if they can cope is a practice from the Middle Ages. And so my first question today is to Professor Hossam. Professor Hossam, many universities are attempting to adapt their teaching methods to better replicate the real-world conditions that graduates will face. How can technology help us to produce physicians who are knowledgeable, creative, tech-savvy, and at the same time empathetic to their patients?
Thank you, Amanda. It's a pleasure to be here, and I'm a surgeon, so I'm not in technology, but I'm deeply in education. But I understand technology. And I think that's what's going to happen and what we need to talk about it. Because future doctor, really, I don't like to focus on doctors, because the future of healthcare is teamwork. The doctor is one player in this teamwork. It is patient-centered, patient and the nurse, the doctor, the pharmacist, the physiotherapist, everybody work together for the sake of this patient. So it's all about communication. Communication with the patient and communication between the healthcare providers. Unfortunately, we don't educate our healthcare providers on all those things to a significant extent. So medical education, the future of medical education or health professional education is not how many credit hours, how many lectures. We don't need lectures. I am telling my faculty, I don't want you to teach. Their role is completely different. They are facilitator of learning, they are role models. But what is important now is to situate the education within a theory which is well known, which is a community of practice theory. And the idea is embed the learner very early in the work environment, workplace environment, to become part of the tribe. And then they will learn their language, their behavior, and how they communicate with each other and so on. So we are shifting now from classrooms to workplace. Okay. From day one, year one. Wow. And going vertically. You've mentioned that you want a graduate who is savvy in technology, and we are now struggling with that, but we are introducing now technology, AI, and all the things which were presented today, how to introduce it in health professional education curricula and spread it vertically. Not they're going to be software engineers, but to understand and Dr. Walid in the previous panel, he spoke about the French. So the two have to be understanding each other, the health professionals and the technologists or the artificial intelligence, and together they can improve the service. So that's the future, what's happening now and what will continue to happen more. So medicine is a social science. It is not only about technology. Thank you.
I'm a big believer in that also. Dr. Saba, good afternoon. In your work, you've talked about 4 golden threads of global healthcare. Please, can you tell us about those 4 threads and the role they play in shaping healthcare?
Thank you, Dr. Amanda, first of all, for a very kind introduction, and good morning, ladies and gentlemen. So, before I start talking about the 4 golden threads of global healthcare, I think I should definitely acknowledge one of my mentors, Professor Stephen Brooks, who's actually the mastermind behind the 4 golden threads. And Dr. Brooks from Manchester University is a senior fellow in public policy and management, and he specializes in leadership and organization development. And the concepts of the 4 golden threads was actually put forward by him and his institution as a guiding trend or a strategic guide for healthcare leaders who are faced by constant and ever-changing challenges in a rather complex and multifaceted healthcare industry that's further complicated by an ever-changing and evolving global environment. And these 4 golden threads actually lays the foundation for healthcare leaders to address these challenges. So the first, excuse me, of these 4 threads is the internationalization or the globalization of healthcare. And you might ask me, Saba, why an international perspective? And the answer is very simple. I mean, the recent statistics have shown that approximately over 72 trillion US dollars, which is approximately 10% of the global GDP, has been spent on healthcare. So arguably, this makes healthcare the biggest industry in the world. So our realization that obviously boundaries exist between organizations, regions, nationals, and supranational boundaries, but to realize that these boundaries might be opportunities for us to share knowledge, to learn best practices, to have sort of decision-making, combined or collective decision-making approaches to face the challenges that, you know, for example, like the COVID-19 pandemic, where we saw a massive intergovernmental collaboration. To add to that, the internationalization also provides a strategic opportunity for the healthcare industry to address healthcare inequalities or standardization of quality across healthcare systems. Now, to support the first golden thread comes in the second golden thread, which is network leadership or working through networks. So as opposed to a single-minded focus of leading through the line, network leadership sort of moves away from a hierarchical top-down to more of a horizontal approach where you have a collective insight into leadership, where knowledge and intelligence is collectively looked at. And again, the COVID-19 pandemic was a perfect example of that, where, you know, different governments and different institutions came together collectively, and, you know, we tried to tackle or address that, you know, that crisis. So this leads on to the third golden thread, which is creativity and innovation. And obviously to address any challenge, and usually unprecedented or unanticipated challenges, if you're not creative, both in decision-making, problem-solving, critical thinking, so basically think outside the box, you're highly unlikely just to draw back on knowledge that already exists. So this reflects on what Professor Hussam just said, that you need to be able not only to reflect in, but to reflect on, learn from, and bring in new experiences. And of course, innovation. And I personally believe that innovation is just not about technology. It's about streamlining processes. It's about data-driven approaches, value-based approaches. So all of those draws in sort of creativity and innovation to bring about change. And the last, but I believe, and I think we all, as part of the healthcare industry, should obviously believe, that is the patients. Although you might think it's a given that the patient is usually the center of decisions that we make, but this is often not the case. And I think it's extremely important for all stakeholders involved in healthcare delivery to remember that patient is the core of every decision making. And the patient should be the driver for any sort of healthcare reform. And also what we need to realize is that the demographics of our patients have changed. And our patients, I don't really like to call them patients because not every person that approaches a healthcare provider is sick. So the word probably is customer or client or consumer is more apt, right? So they're more aware and they should be actively engaged in their care plan, not just passive recipients of care, but a partner in the care plan, taking informed decisions together with their care providers. And we also need to remember that patients or clients, they become more aware of the ownership of their health data. So similarly, to just resonate what was, what was touched upon in the previous panel, I think the patient should ultimately be the core driver of value and public interest. Yeah.
Thank you. I think those are very valuable and interesting principles indeed. Professor Hossam, it's become increasingly clear that significant advancement in human knowledge in fields as diverse as environmental protection, energy creation, international security, as well as healthcare, will only be possible through interdisciplinary collaboration. Healthcare professionals of the future will need to be experts not only in their own specific disciplines, but also in cross-discipline collaboration and teamwork. How can we as educators prepare healthcare professionals for these kinds of interpersonal rather than technical challenges?
Well, I hope you come and visit me in the university, because you'll find on the wall what we say is learning together for working together. We are, as we have 6 colleges, they're all in providing the full spectrum of health professional education. So you find those who are studying medicine, they are very close to the nursing, very close to the laboratory science, even healthcare management and health economics. We have a college in this specialty. We found that it is a bit too late after they graduate and from different educational programs, and you tell them now you have to work together. This has to start early, and it has to start from the beginning, and you keep reinforcing it and strengthening it and create opportunities of working together when they are still learning and they are students in the workplace. And of course, workplace is not only the hospital, but also the whole community. So this is becoming now the interprofessional education. We have a center of interprofessional education, practice and research, because it's one of the very important themes in any educational program related to health professionals. And it's one of the outcomes which many competency frameworks from all over the world have considered communication, collaboration, and teamwork as a very specific competency outcomes, which we have to prepare them for that. So the message, start early and bring them together, and hopefully they will work together.
It's very interesting to all of us, and to me in particular, as communication, collaboration, and teamwork is, of course, exactly what we teach at business school also. So fascinating. Dr. Sauber, could you tell us more, some of your thoughts on ongoing medical education and how that can help enable people to continue balancing between their technical skills and their patient-centered skills?
So Dr. Amanda, like obviously when you introduced me, one of the main things that I do in the hospital that I lead is obviously I manage the quality improvement, education, and development of the hospital. So this is a soft spot for me because I'm a big advocate of proper patient education. So I think, in my opinion, we have to completely redefine the way our physicians are trained and the way our continuous education is actually conducted, right? So I think one of the things that we completely overlook is the ability of our physicians. And when I say physicians, physicians are quite difficult to lead. I mean, they like to have full control over their decision making and over how they operate, right? So they're quite stubborn in that aspect. And one of the things that we overlook is that the ability to adapt, so adaptability, being nimble, and change management. And one of the nicest definitions of adaptability for me is the ability to be aware of the uncertain, the ability to learn, unlearn, possibly fail, and eventually evolve, right? So the adaptability to embrace change, to embrace disruption, and the science behind change management is extremely important. If our physicians or our healthcare providers are equipped with these tools, it makes it a lot easier for us to integrate any sort of radical change within the organization. Now, secondly, since obviously we're talking about healthcare disruption, I think a lot of our healthcare providers, particularly physicians, are fearful of the idea of sort of digitalization or artificial intelligence or computing science because they feel that it's going to replace them. So I think ensuring them that machines and technology is not here to replace you, but to augment your performance, so that their cognitive burden is reduced. Right now, our physicians are these amazing creatures which have a massive capacity to memorize bulks of data and retrieve them really quickly, come up with a differential diagnosis and treatment options. But if you have clinical decision support systems that could help you do that, you have a lot more time and you can invest your cognitive bandwidth on the patient, him or herself. So the humanness of care, empathy comes into play. So then this brings us to educating our healthcare providers with regards to relationship-oriented, as you mentioned, and empathy-oriented care. I mean, you might be aware that on average, a physician interrupts their patient every 18 seconds. And our GE rep at early in the morning actually stated that out of a 30-minute consultation, between 8 to 10 minutes is only invested on the patient. So if you have all these mundane and cumbersome errands and responsibilities handled by AI, it makes it a lot easier for physicians to do more valuable and meaningful chores. Now, and I think it's also important, with what's going on, in the world of disruption healthcare, to educate our patients with regards to basic knowledge of artificial intelligence-based algorithms. So in that case, they will be able to identify weaknesses in software and be able to interpret results of data better. So it's a collaboration, a partnership between a physician, artificial intelligence, where the physician defines the problem, for example, the digitalization, artificial intelligence come up with solutions, and then the physician verifies acceptability of that solution. So that again connects it further with data-driven approaches. A lot of our physicians they don't really understand the value of real-time data, of analytics, of using these numbers to augment and optimize the care that they provide to their patients. And again, to resonate a lot of the talks this morning, I mean, obviously this is my passionate area of expertise. For example, genomic medicine. It is one of the areas in science where artificial intelligence is used tremendously. And this will take us, away from reactive medicine to a more proactive, predictive, and preventive approach. And again, thinking about the COVID-19 pandemic, you notice that we identified that based on the comorbidities and the health status of the individual, the response to disease was different. If you had a comorbidity, you were more likely to have poor prognosis. Similarly, looking at the genetics of the individual, certain genetic combinations increased your risk to COVID, or for example, your signs and symptoms of COVID, So I think to ensure that they have that idea of using data. And I think last but not least would obviously be value-based care. I think it's extremely important to ensure that value undermines any sort of change that we want to implement on them. So training and continuous medication education should step away from being a formal, infrequently happening event to something that's lifelong. It's just in time, in smaller sort of intervals, but more incremental in nature to eventually achieve the optimal outcomes for both the healthcare providers, the institutions we work in, as well as for the patients.
As an expert in organizational leadership, you can really provide us with such valuable insights. And isn't it interesting, it was a theme of this panel and also of the last panel, how people fear technical advancements in artificial intelligence because they think it's going to replace them. And yet fundamentally, as a behavioral scientist, I'm aware we're mammals, and mammals are a social species. And although a lot of the mental health issues arising from the pandemic came from the disruption to people's daily routines, an awful lot of the problems were caused by a lack of fundamental human contact. And so the notion that in the future somehow we would be able to do without fundamental human contact is clearly erroneous. I think we might be a little short on time, is that correct? Okay, so what I would like to do is ask each of our two panelists, if you had to choose what 3 capabilities you think, if you had to choose only 3 for the future, what 3 capabilities would you say were the most crucial in educating our physicians and healthcare providers going forward?
Well, I think they have to be very inquisitive, not accepting everything as it is. People keep talking about critical thinking, and critical. You cannot teach critical thinking. You have to create environment to allow this critical thinking to take place. But I'm a big believer in what I've previously said, that we have to bring them to work together and to collaborate together in providing the service. So developing effective teams is very important. Talking about technology, we have already now introduced technology, artificial intelligence, data sciences, all this in the medical program, and spreading it over the 5-6 years and beyond. So this is going to be strengthened and more. We are still, we don't know exactly how to do it, but we have started doing it. The third point is that I think from a system perspective that the private sector is going to play a very important and should play an important private healthcare system, I mean, in the developing on the health workforce. Governments, government hospitals, government universities cannot do that alone, and this has been published by many internationally. There is a big shortage, so the future is going to be developing more the academic health system, where academia, research, and healthcare integrate together, even in the private sector. So I think this would be trends which will increase over the, very soon, over the coming few years.
Thank you, Professor.
Right, so Dr. Amanda, I'm going to approach it from 2 perspectives, because A, leadership, and B, organization culture. So I think in terms of leadership, you would need leaders, healthcare leaders that are visionary. They have to be transformational. They have to be a collective in their approach to leadership, and of course ethics and integrity. And in terms of organizational culture, I think our healthcare institutions need a culture that's inclusive, a culture that's people-oriented, team-oriented, and outcome-oriented, and a culture that's open to learning, innovation, and risk-taking.
Thank you very much. I'm going to ask the audience if we have anybody who would like to address a question to Dr. Saba or Professor Hossam. and I can't see the audience, so you'll have to let the people with the microphones know. Yes, it's very bright. Go
ahead. Thank you, doctors and professors, for the wonderful comments. My question to Dr. Asaba, I'm a big fan of what you do and what you've been achieving in this wonderful country. My question to you, in terms of personalized medicine and how this will upgrade our future physicians, what is you mentioned skills, you mentioned some cultural aspects. What is the one thing that you would advise physicians to focus on that will make the biggest impact? Just that one thing from your experience.
First of all, it's fantastic to see you, Dr. Mazen, always fabulous. So you mean with regards to genomic and personalized medicine, Dr. Mazen? I think it would be education, because I think our physicians are very far away from being able to interpret genetic information today, even with regards to prediction and prevention. I'm just going to give you a very simple example just to underscore what I said. Is that right now the average cost of, for example, treating a metastatic colon cancer in the USA is approximately $50,000 per treatment, yeah, per course that you do. And based on the research and the studies that have been done, they estimated that if we used a simple genetic test to predict the increased risk predisposition, for example, colon cancer, or to use genetic testing to identify personalized medication approaches in terms of chemotherapy, immunotherapy, you would reduce the cost to healthcare for over $600 million per annum. So I think it's education, education, education.
Hi. My name is Hannah, and I'm a senior nursing informatics in Saha Corporate Saha in Abu Dhabi. Now, I'm addressing a question for Professor Hussam. I'm very pleased to hear from you that the physicians should be enabled with the digital technology, and that they should be enabled with the digital concepts so that they can perform better for the future. Now, my question to you is that what level of skills and knowledge is required at this moment? Because I would say, are they requiring a certain level of certifications, certain training, hands-on practice, or it might be even to the level of a board like it's being practiced as a physician? So can we look for the future? We will have a physician informatic as a specialty, not as a practice, being certified and being offered. And is there any other opportunity that we have them functioning, like we will have physicians who are using technology through the education with simulation, as Dr. Asaba, or with research or functional role of using the digital health, again, in improving the physician or the medicine. Now, I'm facing that with nursing, so I think whatever we will take, I'm going to take back into nursing.
Thank you. I think, let me comment first on nursing and the technology. I think perhaps physicians like me, good part of what they're doing maybe could be replaced by a machine later on. The only thing which cannot be replaced by a machine is nursing, because they are very close to the patient and they talk to the patient and they spend more time with the patient. So I have the highest respect and appreciation of what nurses are doing. Coming back to your point about what we should prepare this graduate, whether nurses or physician or any other health-related profession. As I mentioned before, that they are not going to be software engineers, or they develop the machine or the software, but they have to understand. At present, there is a total confusion. You find people talking about artificial intelligence, blockchain, virtual reality, augmented reality, as if they are the same in a way, something like that. While defining and understanding what are we talking about, that this is what we do in the first year of medical school and at the moment. So we introduce them to the ethics related to that, and gradually we keep building that they start learning about algorithm, the principles of algorithm, and gradually we develop a vertical theme, as I mentioned, in technology and data sciences. So it's becoming part of the curricula, not only of medicine, but also of nursing and of other professions. So it's across all the program in the university. And then we create situations where they can interact with the expert in the field of software and so on. And that we create clubs. Those who are very savvy, those who are very interested, they can integrate with the industry, and they hope the industry can help the education and work with education, because they are the ones who are going to use their technology later on. So we have to prepare them for the new work environment, which is very rich in technology and AI and all these advances. We are actually also using artificial intelligence in training and simulation. So we have developed virtual patients, which are human beings. They are actors, but we've had, so I'm not a technology, but I've developed the scenarios, the scripts, which with a technology company, we were able to create this and use pattern recognition and so on, so forth, which is used in our university, and 26 universities are using this virtual patient. Even you can see the emotion on the face. So simulation will play a role in training the students on things which can start very early, preparing them for the future.
That's fascinating. Thank you. We have one more question. We have time for one more question. Do we have any other takers?
Thank you very much. One, we said, and it's very interesting to hear about how to beat the cultural change in adoption and create the confidence in adopting technology and digital. It's me, sorry. Here we go. I stand up. And this is something that is, it's very challenging, but at the same time, I feel that is based on a scientific principle. So both medicine and technology come from a scientific world. So converging on data and the validity of data, I think it's something that it's doable. But there is another cultural change that we are leading now that we discussed even before, this convergence at platform level between medicine and wellness that of course are bringing also a different discipline, now more traditional medicine on one side and more alternative medicines on the other side. How do you see this other challenge to be faced in the next future?
Should I take it?
Yeah,
right.
thank you.
So, fantastic question, first of all. And I think I'm not going to say the future of medicine, because I think the future of medicine is already here. It just depends on how ripe we are and how accelerated we are in that direction. So eventually, the lines between sort of physical, digital, and biological spheres are eventually going to be very, very vague. And this eventual, destination that we're heading towards, where you're talking about sort of wellness in association with digitalization technology, is again, it's here. And this I speak from experience, because this is this is what we do. The use of computing science and digitalization, artificial intelligence, has completely disrupted the world of genomic medicine. Right now, in addition to the Internet of Medical Things, AI, its interpretation for genomic data is actually driving predictive, preventive, and personalized medicine. So based on your genetic information, based on your genetic constitution, I can basically tell you, I mean scientists and physicians can tell you whether you have an increased risk for a certain disease condition, for example, cardiovascular disease, or for example, a certain type of cancer, or for example, Alzheimer's disease. But to make it even more exciting for you, we are at a stage where we are using genetic information not only to predict your risk predisposition for disease conditions, but also to use the genetic information to customize your lifestyle recommendations. So we are able to tell you that based on your genetic constitutions, what sort of diet you should follow, what sort of exercise regimen you should engage with, what sort of medication you can and cannot take, for example, how much sleep you need. I mean, so I like to call this your dictionary of life, and this is something that's happening. I mean, I actually had my consultation for patients where we refer to this as prognostic genome data, and we're actually doing that. And again, also to make it a bit more spicy, it's a world of omics. So it's not just genomics. Now we're using microbiome data, we're using proteomics data, we're using data based on your metabolic footprint. And all this data is eventually consolidated to come up with solutions. And this is where artificial intelligence is aiding us, because it's beyond the cognitive bandwidth of any scientist or clinician to be able to analyze that on their own. So I think the aim is both, eventually in terms of the cost benefits, for insurances and on the economy, to have a community that is healthier, and to address these by prevention, prediction, and more proactive approach to healthcare. I hope that sort of answers your question. Thank you.
Dr. Saba and Professor Hossam, thank you so much for giving up your valuable time for us today.
Thank you so much, Amanda. Absolute pleasure. Thank you, ladies and gentlemen.
Thank you very much, Dr. Amanda, Dr. Hossam, and Dr. Saba. Very nice to have all of you here. We're coming to the end of the first part of the day. Just a couple of housekeeping notes. First of all, Reem is saying hi to everybody. Reem hasn't been able to come because of an injury that she has, and please pray for her to recover soon. But she's saying hi to everybody. The second thing is, the one-on-one meetings will start in the room next door, so please make sure to be on time and not to miss your meetings. There will be coffee and light bites served outside at the moment. Lunch will be served at 1:15, and we'll be back in this room by 2 p.m. Meanwhile, enjoy the rest of your day, and I'll see you again in a couple of hours. Thank you very much.
Why should you invest in stock? 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 Why should you invest in stock?
I've waited so long. I've waited so long.
Great, welcome back everybody. I think if I then got up here and start, people will still be outside, so let's kick this off and come back to our interesting panel discussions. All right, next up is the opportunities, challenges, and strategies for digital transformation. Finally, we're coming at the topic that everybody's asking questions about. In general, we all know that there is a massive change and a massive transformation in this region when it comes to digital. And we were just discussing outside over coffee how digital can be misleading sometimes, and when done right, it can leapfrog this industry and leapfrog patients' experiences and patients' lives for good. In this panel, Dr. Mazen, and I'll come to the introduction in a little bit, will guide you and will take the conversation when it comes to topics like cybersecurity, electronic health records, applications and different digital health implementations in the region, what is happening, what is the gap, what's going to happen in the future, how to make that work, and so on. Now, I picked up Dr. Mazen's CV to introduce him, and if I start introducing him, I will really take up half of the time, so I'm going to be very brief. So Mazen is the Director of Partnerships at the PMI local chapter, and he runs a similar role within IQVIA as well. In their public payer, provider, and government practice. He's a digital health transformation advisor in different entities, and he has interesting experience between working for the private sector and the public sector. So he has worked for SIHA, he has worked for DHA. In the private sector, he's worked for Cerners and PwCs and all those big names that we hear about all the time. He's currently running his postdoctoral research in value-based care and digital transformation at the University of Northern Florida. Dr. Mazen, off to you. I'm going to leave the floor. Good luck, and have a great time.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good afternoon. And I'm glad that you guys are well fed, so you're all relaxing after lunch. Words coming from your mentor it's hanging like a certificate of appreciation. So thank you, Dr. Ahmed, for always being a mentor and a friend as well. So today we have a number of great superstars, mentors, coaches that I've had the joy to learn a lot on their hands. And I think let me introduce them into our not virtual podium this time, it's physical podium. And how happy am I to see you in person and breathe the same air that you are breathing with a mask on. Okay, so let me start. And without any order, I will start according to the brochure. Let's start with Ahmed Awada, Senior Manager, Virtual Health in MediClinic Middle East. Let's put our hands together for Ahmed Awada. Please join us. I have also Abid Shah, the Chief Information Officer and Chief Digital Officer, Saudi German Hospitals Group, UAE. And as I promised you, this is the League of Superstars panel discussion. I have another two superstars that I would like to introduce. Sir Abid, thank you. We have Dr. Usam Al-Hassan, Specialist Health Informatics in Smart Health Department, Dubai Health Authority. And saving best for last, as they say, Dr. Haider Al-Yusuf, Managing Director, Al-Futtaim Health. So what I would encourage our audience, number one, take notes. Number two, please present yourself if you have any questions, because I am not able to see you, so I will rely on some eyes on the ground and some ears. So maybe somebody who can help me to just identify, and there is a mic, a couple of mics that will be coming around if you have any questions. Okay? Is there anybody? Who's the mic person today? Okay? You'll be the mic person. So if you have any question, we'll actually put your hand up and he will alert me to your question. Is that good? Fantastic. And the rule of the game, before you ask a question, your name, who you represent, the company you come from, and who you would like to ask, and then you throw your question. So let's start this game. That's okay. Thank you. So, okay, let me start, since I have Dr. Haider next to me immediately. Dr. Haider, with your illustrious experience and background, and me being one of your students, what is, as you now come out of pandemic, as we come out of the pandemic, in the digital transformation, what are some of the new advice or challenges that you see in the coming 6 months to 1 year?
Thank you, Mazen, for this introduction. I think obviously the pandemic, when it comes to digital health and disruption within digital health, I think pandemic has probably been one of the best accelerators for digital health. As we were putting our plans earlier in Al-Futtaim Health into how we want to move into the digital space within healthcare, there was a lot of challenges and regulatory restrictions on digital, and we were thinking this may take 5 years or 10 years. And the pandemic, I think, made it happen in a year and a half now, basically. A lot of the sort of push towards digital through obviously the convenience and the lower contact brought in by the pandemic had been good for healthcare. And it only means that the move towards digital is going to be much more aggressive and faster all over the world. I think the problem with digital health has been that the technology in many other sectors have taken on and become a complete replacement to the normal solutions, or what used to be the normal solutions, but healthcare not so much. So today, I don't think you can imagine going back and queuing in the branch for your banking sort of transaction to go and withdraw money or transfer money from one account to the other or pay your credit card, or similarly in other industries. You know, digital have replaced completely most of the regular transactions, but healthcare had been quite slow in that. And I think going out of the pandemic, we will see a huge movement towards digital health. And I think healthcare organizations that don't move into the future will become the Nokia and the Kodak of healthcare. They will just cease to exist if they don't embrace the digital transformation that this has brought upon us.
Excellent, excellent. And thank you for opening this session with such a great vision. And having been part of one of the visionaries who've placed one of the biggest digital transformation initiatives in the Emirate of Dubai, the eClaim Link. But let me ask you, Dr. Usama, as a regulator, and now you have one hand on the data element, the data governance and the ground-shaking rules that are coming out, and another hand on the vendors in the market who are actually trying to be part of digital transformation. So my question to you would be, Doctor, what is your advice, knowing that there is new data amendment to the data law, and how the vendors could actually become more vital players and partners, not just selling. What are your thoughts, Doctor?
Yeah, that's completely right. So I can give you one simple example. So we're talking about the NABID program, which is the HIE across the Emirate of Dubai. We can never realize this project without the full support from the EMR providers in the market. And we started the journey from day one, trying to bring them on board, letting them know about what kind of standards we are going to adopt, what kinds of technology that we need to adopt, what kind of processes for onboarding of those clinics and hospitals. And even now, we push them one further step to come up with new, I can say, business models that can allow those small clinics to be onboarded into the digital. So we have hundreds of clinics that they don't have EMR. So how can we go about this? By providing them with pay-as-you-go solutions. So we started to have this kind of communication. The second part that, or kind of recommendation that I give to those vendors, that they need now to also try to pick and choose the right human resources that can help them to go through and navigate through these regulations around privacy and security. These kind of regulation needs competencies that actually are not in the market. So either you import them or you create them. And you need to focus on ongoing training on that aspect as well. The third question is also now they need also, rather than just being compliant to the regulation, they need to look into opportunities that these regulations are giving to the market. So now we see new care models are not just, I think 5 years ago we were talking about digital solutions that enable new care models. But actually now we see new care models that are built on technology. They emerged because of new technology. So they need to look into this opportunity, have the guts to do POCs, have the guts to navigate territories that they haven't reached before. I think they need to have this kind of R&D. It's very important and will open for them a lot of opportunities.
Excellent, excellent. And the order is amazing because Abed, you come next. You're a private sector leading facility or network of facilities. And likewise as Ahmed, and I'll come to Ahmed, but Abed, to you, we've talked about some of the digital transformative initiatives like the eClaim, the NABID, the data governance. And we spoke about how we mature up in building this relationship with vendors rather than selling, participating, R&D in that relationship. What are some of the specific challenges that you would like to address in this panel today?
Okay, I think, firstly, there's a lot of opportunities, okay? So what's, with the digital transformation, with COVID's brought a lot of investment into the sector. But it's actually accelerated transformation. So, when I was speaking to a number of people, chief execs basically, what they said was, look, it's accelerated transformation with urgency. The way we're offering service has changed. So what we're now looking at, as for example, as a private basic group of hospitals, is delivering world-class healthcare, okay, but in a different form, Okay, that's the challenge. Whereas before, basically, across the GCC, we have a lot of footfall, we have a lot of patients that come to us. We still have those patients, we have more patients, but the way we had to deliver that service to the patients across the GCC was different. The likes of telehealth, okay, we had to deliver that fairly quickly. The communications with the patients as well. So one of the key things with digitalization, and we found over the last 18 months, is you need constant communications. People are worried about COVID. They want COVID tests. They're worried about their well-being. They're worried about post-care. So one of the things that's kind of changed for us is actually looking at that health service end-to-end. So now we're looking at the well-being of the patient, making sure that they're healthy, delivering technology to them so they can actually measure some of the vital stats. We can communicate with them all the time. There's someone available for them 24/7. Then it's their journey into the hospital as well, okay, flowing through that. But then it's also post as well, actually communicating with them, looking after their kind of health, making sure that there's someone there. But, you mentioned the vendors, they play a fairly fundamental role in this, because we can't do digital transformation on our own, okay? What we can do is do the end-to-end blueprint of what that customer journey is, and technology is a key part of that. And then it's actually working with the different vendors to actually plug those technology basically end-to-end. But the other thing I was finally going to mention was that we're not only looking at our own sector, okay? We're talking to vendors, some of the major tech companies, major suppliers outside our sector as well, on a kind of global basis.
Excellent, excellent. And this is an important outcome of COVID. Now, healthcare has become multi-sectorial, has actually dissolved the barriers between the different sectors and industries as we learn from the others. But maybe, Ahmed, if I bring you also into the forefront of this, because again, you are leading a team of virtual health enthusiasts within Mediclinic. I mean, how are you finding working with partners? Do you put all your eggs in one basket, one partner for all, or all one thing across multiple partners? How do you see virtual health coming into Mediclinic?
It's a very interesting subject, actually. We were just chatting with Abida about it. See, it's one of the biggest problems that we have in healthcare is fragmentation. And fragmentation is not only in the solutions, but also in the services. So you'll have one company offering telemedicine, another one doing the hospitals and clinic, another one doing the home care. And look at the technology solutions, you'll find it fragmented in the same spectrum. So when you're trying to have a digital health strategy and trying to get all of these pieces of puzzle together, it's really hard. So you would need to have some compromise of some integrations required between the solutions to work together. And all of that is happening because of the healthcare consumerization. The consumer now is looking at healthcare as the way he's looking at other industries. He would like it to be on demand, easy to book appointment, to do teleconsultation, to access his Medicare record and all of that. And you can imagine in a normal healthcare facility, healthcare provider, you have a system for the HIS, a system for appointment booking, another system for teleconsultation. So putting all of these together, I think that's the biggest challenge that we are facing at the moment. But I think the strategies that we are trying to tackle that is to see which one is the most dominant in each area that's able to act as the digital front door. And I've seen multiple initiatives in the country where some providers are trying to solve this problem by having one of these vendors as the digital front door, then plugging in the other vendors as well.
Excellent, excellent. And Dr. Haider, because I'm very interested to ask you this question. Part of the leadership team that looks after Al Futtaim Healthcare Group, and also with your background as one of the regulators who disrupted the health insurance world. If you look at an insurance, all the insurance companies who are present here or not in this conference, what would your advice be? How can they be part of that digital transformation in some of your experience and some of your futuristic vision?
I think insurance generally has been a very an industry that's very resistant to change and to movement. And I think with eClaim Link, that was a huge sort of transformation into a different way of doing things. I think now insurance companies are the payers, so they hold the money, and at the end of the day, in any system that's funded by insurance, the payer has to be open to that change because they have to fund it. So we see, for example, insurance companies paying less for telehealth transactions in comparison with in-visit, but actually in a telehealth transaction, you're also less likely to order tests, you're less likely to order labs. So there is already a saving and a control sort of the utilization by the fact that it is a telehealth consultation. So being a bit more open to actually this new ecosystem is very important, because what the future organizations are trying to create is a continuum of care type service where the patient, whether they're accessing your organization through digital, through physical, through multiple outlets, you're actually trying to make that patient healthier, happier overall. And I think the payer need to be able to allow that transformation, because it's a transformation that will actually allow them to save on their bottom line. So being open to it will control utilization behavior and will actually mean that they pay less only if they are open to it.
Excellent, excellent.
Let me just jump on your previous question, because I think that's an important one. You spoke about vendors, and I think in this part of the world, we need to see vendors, and vendors need to see themselves not as salespeople of a product that they have, but as partners that work with healthcare providers to co-create something new. So in this part of the world where we used to think we're followers, the products will come somewhere and then we will follow and buy the same products and try and implement them. That doesn't work anymore for this part of the world. And I think we proved with eClaim Link, we created a solution that the whole world looked at as a benchmark and the whole world adopted. So in this part of the world, we can be creators, but that creation process needs the two partners, the regulator, the three partners, the regulator, the payer, and the providers to be part of that relationship. And together, let's create something new for this part of the world that takes us into the forefront of healthcare service delivery. So we're not really looking to see vendors as suppliers or sales function, but much more of a partners in a creation process.
Excellent point, excellent point. And this highlights the importance of transaction the transformation that is happening in the healthcare industry from a consumption-based industry to somewhat a production-based industry. But again, that brings another question to you, Dr. Osama. One spot close to your heart: workforce, skill set, talent in the digital transformation. As we grow into R&D, more partnerships from the technology vendors, more R&D, where do we plug in the gap in the e-health or digital health workforce talent? That's an area of close to your heart, let's say.
Yeah, I think this is one of the biggest challenges that we have, not only in the UAE, maybe in the entire GCC region. We still, when we talk about digital health transformation, everybody is happy to invest or pour money on systems, on hardware, but when it comes to people, when it comes to new roles, when it comes to new competencies, now the decision maker will be a little bit hesitant. Should we invest in people? I may invest on a bunch of people and they will leave maybe within a year or two. We should think more strategically. So, and even now, this is one of the new strategies of United Arab Emirates. They want to create new jobs for their graduates. And I believe healthcare in general and digital health will be one of the best I can see arenas to create new types of jobs, new types of career path for Emiratis to come, and these are well-earned jobs, well-rewarded jobs. They have a good career path, they have a good development, not only as a government job, but even as an entrepreneur, even as owners of SMEs that can prove concepts in the UAE and then go outside to show to build investments around that. So I believe that we need to focus more. We need to have a good, I can say, HR plan for bigger jobs, so even for a project like NABIT, for example. If we do the proper HR planning for such a project, we can come up with hundreds of jobs that can be that can have our new graduates land into it and have a long life career path.
Excellent.
So we need to think about that.
Excellent. And I just give you that logical kind of flow. So we started with talking about payers and what sort of disruption do we expect them to have in the digital transformation. Then we moved into academia and the role of bringing a pipeline of workforce talent into that digital health transformation arena. Now coming into Abid as well, my question to you, what would you expect from the regulators, especially in the digital transformation, and you work on a regional platform, not only UAE, you focus UAE, KSA and whatnot. Yeah. What are some of the advice points that you would like to hand over to them?
I think the key thing for us is we have a very close relationship with the regulators, basically, across the region. With NABITH, Rayati basically coming in the Northern Emirates, something similar basically in Saudi, other regions. The key thing, for us is working close with the regulator is that we're sharing patient data. What is that helping us to do? It's helping us to improve the quality of that data, okay? Because the most important thing for us is our patient data and the quality of that. Because, the key thing is that it gives us great insight across the region into our patient, because the way we're operating is a patient can actually, go to Riyadh and then come and see us in Dubai, okay? We will have centralized data, we will have a whole history of that patient. But the key thing is working with the regulators, we will secure that information of that kind of patient. We'll make sure that the quality of that data is very high as well. So for us, with the regulator, it's a very open discussion. We share information, we get a lot of information back, we get a lot of regular visits, we have a fairly kind of open, transparent kind of relationship. And I think for us, that's fairly fundamental to offering that world-class health service, okay? Because those controls and those checks and the governance is very, very fundamental, because the protection of the patient is key for us.
Absolutely, absolutely. Thank you for highlighting that, the role of regulator in the digital transformation disruption. Right, and to you, Ahmed, if I may, bring in the role of patients now. From your arena, where you've actually been building the virtual health, let's say, disruption into the ecosystem of MediClinic, how do you see the role of patient being disrupted? Do you see more feedback? Are you getting them involved as you transform and disrupt your healthcare? What are your thoughts on that?
Yeah, I say the patient is very important to consider them in this journey, and many of the attempts that I've seen that didn't really consider the patients, they failed. So what we have adapted internally to have user testing sessions where we test on a group of patients the new initiatives that we are doing. The recent one is the remote patient monitoring, and see how they will react to that. Because you might be sitting in the corporate office with all your knowledge and all of your degrees, and you think this is how it should work. But in reality, it might be totally different. And this is very famous in the product management called survivor bias. It was a story in the World War II, the airplanes, the fighter jets, that they were coming back, they always had holes in the wings. So they thought that the problem in the wings, let's fix the wings. But the problem actually was the cover of the engine. And that's why they were not coming back. So sometimes, because you're working in that day and night, you might be biased. It's very important to involve them, create these user testing sessions and involve them and see what's their feedback, enhance and keep going in an agile manner.
Yeah. Absolutely, the involvement of patient advocacy groups and patient groups in here. So I'm just conscious of time, and I want to make sure that if I see a hand being raised, because you have, an esteemed panel of experts here, and if you have any thoughts or questions, please raise your hand. And there's a question, okay? The rule of the game: name, organization, question, and the target panelist, if possible. Go ahead.
Thank you so much, Dr. Mazen, and thank you to the fabulous panelists for a very insightful discussion. So I have first a question for all the panelists. I'm happy for anyone to take it. And this is from a consumer perspective. And here by consumer, I mean patients. So what we've actually noticed in our patients is the shifting demographics. You've got your millennials, which are sort of quite healthy, not so wealthy, tech savvy, very keen on self-service platforms and integration of digitalization in their health services. And on the contrary, you've got your baby boomers, which are not so healthy, but a lot more wealthy, not so tech savvy, that might not be very comfortable with integrating digital technologies in their care plans. So, and obviously, within the UAE, based on what the statistics shows, we have a very high population of baby boomers that we need to pay attention. So I just wanted to know your insights, how you balance in meeting the expectations of the various consumers that you deal with. This is one. And my second question is for Dr. Osama. So Dr. Osama, I mean, obviously the fact that you work with health authorities, when you take into consideration the various stakeholders that are involved in, bringing about the implementation of digital transformation and the different competing interests that they all have, what are your insights at how, to bring everyone together with the patient at the core of the decision and the public interest to ultimately achieve the disruption that we are hoping to achieve? Thank you.
So you're talking about the ecosystem management, how we can manage
Yes,
the ecosystem.
with the various stakeholders, so your buyers, your payers, your patients, your vendors, so everybody. So unless you have everybody on the same page, it's practically impossible to implement what we're trying to eventually achieve.
So actually, this is one of the biggest questions now we are trying to answer through our new digital strategy. So actually, we realize that our ecosystem is not only vendors, or I'm talking digital vendors, I'm not talking about patient direct, but even we have like kind of 3 circles of vendors. So the inner circle, which we all know, and then we have now, because now healthcare is going one step beyond to talking about social determinants of health. So we need to talk with social system as well. We need to talk also with the government organizations. So we're making sure that now healthcare is part of our national security. And we learned this lesson from the COVID for sure. So what we are trying to do now is to engage all stakeholders in the regulatory aspect. So when we come, for example, today to come up with a new regulation that will affect the stakeholders, we need to bring them on board. So this is one thing. The second thing, as we see that now, I'm talking here about Dubai, for example, which is trying to have a new kind of digital economy. We think that as regulators in DHA, we are now thinking of developing some sort of a regulatory sandboxing. So if there is a new idea coming by SME that they want to do a new concept or a new care model that is around digital health, but the regulation is not helping it. So we can come together and come up with a sandbox where we try how we can manage this and how we can tweak our regulation to be able to make this happen. And I believe this sandboxing solution will be very strong, especially with not only with vendors, but with SMEs, and I think innovative companies who want to make something to prove it in Dubai and then bring it to the world. So I think this will be a very, very strong tool for us. Thank you.
Excellent. I think your first question needs also.
Yes, it's the baby boomers versus the millennials and how we are planning to balance that.
You have 10 seconds, Abid, and then 10 seconds.
Yeah, so what I was going to say was on your first question is it's actually looking at that patient journey, and it's actually looking at the personas in that journey. And then, when you look at the personas, basically you've got different age groups in there as well. You'll be amazed, but 0 to 4 is very important as well, basically, when we looked at that kind of data. So as part of that digital journey, we're looking at that complete patient journey for all the different age groups, all the different touch points. We're looking at that data, and then we're looking at how we're communicating with them and how we can kind of make it better. And we are kind of looking at different ways to actually connect with the patients. Digital is one of many ways that we're looking at. It's not the only way, because you've got people communicating in different ways. Some of our patients prefer someone to be at the counter to kind of guide them through the hospital, to kind of talk to them. So we captured that as part of that patient end-to-end blueprint.
Yeah, I'll just give you a quick story. It involves Dr. Haider, actually. When we did our remote patient monitoring in my earlier company, and we were rolling it out of Dr. Haider's team in DHA at the hospital at home program, we were expecting at that time that the patient will open the app and take the reading through this IoT device. So he will be looking in the app and he's doing that. These were the millennials, or I would say around 40s, that they were able to do that. But we had to adapt when we started the pilot with them by doing background reading. where the patient will just take the reading. He doesn't need to worry about synchronization. It will sync in the background. It was the feedback that we received from DHA at that time, that we need a seamless experience. We don't want to change the patient behavior. You need to look at it in a modular way, that when you have the millennials, you might be giving them lots of these boxes. But when you go for elder groups, you might need to be more dynamic. One of the good things that I've seen after that project, a company that has an appliance that you put it in the house, it's not even an app, an appliance, and has a small screen and a button of yes and no and some reminders, and it acts as the gateway. So you need, the point is that you need to think about it from the patient experience, from the going back to the user testing sessions, listening to the feedback, having different experience for each personas. Yeah.
Excellent, excellent. I know you have...
Thank you. Just rule of the game, Sabah Habibullah, Director Accreditation, Quality and Safety, Iranian Hospital.
Thank you, Dr. Sabah. Thank you for adhering to the rule. I know I've been asked to actually close the session, but I know you had a question. I would love you to get in touch with the panel. We have a next, I think, the meetings that are going to take place. So I would love you guys to put your hands together for our wonderful panelists. Number 2, jump on them immediately because they're going to leave back to their busy schedule. And number 3, get connected also on LinkedIn if possible. Thank you so much. Thank you.
Thank you, Dr. Mazen. Thank you all for our esteemed panelists. We break again now for the one-to-one meetings. Please make sure that if you do have meetings, to go straight to the meeting room. If you don't have meetings pre-scheduled with one of the sponsors and you still would like to speak to them, please let our team know and they will schedule ad hoc meetings for you. We will convene back here at 4:15 for our last panel discussion revolving around how artificial intelligence and blockchain driving precision medicine. So I'll see you all back here at 4:15. Thank you.
I've waited so long. I've waited so long.
Panda Mix Show.
Mix Show. This is Polished Chrome, and you are watching the Pandemic Show on YouTube.
Hello, everybody. I hope you had a good meeting, or good set of meetings in the room next door. This brings us to the last panel and the last session of today. And we have mentioned value-based care today at least like 4 or 5 times. And it gives me a great pleasure to introduce a person who had a first-hand in designing case studies and use cases for healthcare implementation of value-based care model. A person who worked firsthand with Dr. or Professor Michael Porter, who put this concept forward. Our guest panelist, or like the chairman, is a physician by training, and he's a senior partner at Strategy And. He has supported major healthcare transformation projects across the region, and he has worked with clients and with partners across the payer, provider, and government sectors. He is also a practitioner. He's a clinician who's been on the other side of the story, who has seen inefficiencies and has seen firsthand how improvements and how value is created when it comes to the patients. Please welcome Dr. Mark Khayat to the stage.
Thank you very much for the introduction, and good afternoon, everybody. I hope you've had a fantastic session and a great Congress. I know it's always difficult to be at the end, but hopefully we've left the best for last, and want to bring a lot of energy, a lot of excitement with, I think, a very interesting topic around AI, blockchain, and how that actually translates into precision medicine. So a lot of buzzwords there. We'll aim to break it down. We'll aim to simplify it, bring it to real-world examples. And then most importantly, identify concrete areas of opportunities that are imminent here and not necessarily on the horizon. So very excited to introduce the panelists, and what I'd like to share with you is a very diverse, very well-rounded panel group that will bring insights not only from the investment side, from the strategy side, but also most importantly on the patient care side with frontliners. So let me start just in order of proximity. So with me here, Vishal, if you can come up to the stage. Vishal Sharma, he's the operating director of Global Ventures. He manages investments and value creation with portfolio companies that focus specifically on medtech. He was formerly head of digital strategy and venture investments at NMC. And he's working now across the healthcare ecosystem really to match funding with interesting emerging opportunities. So thank you very much, Vishal, for joining us. Next, we'll invite Saad Harakat. Saad is the board member, and he's of the Global Innovation Institute. He's a consultant in his previous life and continues to be on the scene, working extensively previously with IBM, but also with group hospitals, around digital transformation, AI, analytics, so on and so forth. And today spends a lot of time with startups helping to coach and bring innovative ideas into the market around blockchain and other emerging technologies. And then finally we have Aisha Al-Mahri. Is Aisha there? Wonderful. Aisha is the Group Chief Nursing Officer of the Abu Dhabi Health Services company, Saha. She's also the president of the Emirates Nurses Association. And she's worked through her extensive career on bridging the gap between clinicians and administrators on crucial initiatives. And we'll hope to hear from Aisha a little bit about how all the buzz and translation of these different tools, use cases, actually needs to translate into real-world applications. So please join me in welcoming the panelists. Fantastic. So just to put today's session into context, so, as you've heard across the Congress, healthcare remains one of the most critical problems and opportunities, that any health system or any system across the globe faces. We see that there are rising expenditures in healthcare, tremendous amount of variation in quality. There's never been a more complex time in healthcare. I mean, just to put some numbers into that perspective, if you were to look at the number of ongoing clinical trials in lung cancer today, that would be around 2,250. So imagine that you're an oncologist in the field of lung cancer. How would you know how to navigate all the complexity and understand what is actually best for your patients going forward? And then also the data and the information. It's estimated that about 30% of all information that is generated globally occurs within health industries. So a tremendous amount of information, but really challenges on how do we make that information a little bit more useful. So AI and blockchain are definitely some of the emerging technologies that we really see as solutions to help solve real-world problems. But some of the challenges that we've seen is that usually it's about how do we shoehorn a technology, an application, a tool into a system without really addressing real-world problems. So today in our panel discussion, we'd really like to focus on how do we accelerate the adoption of AI, blockchain, and these technologies to bring precision medicine, and specifically what are the use cases that are most exciting going forward. So I'll start by handing it over to the panelists and maybe just an opening question, and we'll go in clockwise order around how are you using AI, blockchain, these emerging technologies in your day-to-day practice, and what are some of the technologies that excite you the most going forward? Please.
Okay, so thank you, and I'm really pleasure to be with you and standing till the last moment for today's session. And let me just summarize it for you, as I'm working in Abu Dhabi Health Service Company, and in the last 5 years, the introduction of the AIs was like a kind of a major drive in order to uplift the healthcare services. How we are using it, and what actually, where we are today, and especially in the last year when we went through the COVID, and then we realized really the importance of utilizing the technology in driving the change and also to overcome the challenges. So the AI actually, and in the other term, AI cannot stand alone. It's on the opposite side is the data, where actually in any healthcare institutions we will predict, and the prediction looking into the pattern and the trends that it help. Like for example, if we talk about the blockchain, so we look into the resource utilization, about the consumption of some of the elements, especially if it is consumed heavily, and why, and if it's costing. Second thing that it really, which currently we are doing, and even globally it's happening, is modeling of the healthcare. One of the scenarios that we went through the COVID last year, when every time we look into the data elements using the solutions and the platforms of the technologies that we are using in different aspects to predict and what will be the model of the care that it will be happen in the couple months. If there will be, for example, adding some of the algorithm, like number of the tests, number of the patients, this is the rate of the exposure, and then we'll say, okay, after 6 months, this is where we are reaching. So the AI was helping actually to model where we are, especially in some of the emerging and unexpected situation. If I'm allowed to bring another example, ADNOC used that. ADNOC even used the AI to model and to predict where we are actually will be in terms of the healthcare services and in terms of the contain that emerging situation. The last point, it's about, if we talk about the automating the manual task, maybe that was the basic concept of the AI early. Today it's not about automating the manual task, it's more towards efficiency and the productivity of the workforce. So it's not about actually replacing the people. If I can do this work, rather than 5 nurses or 5 doctors will do a prescription, I will do using the AI. It's about increasing the efficiency of the workforce by utilizing actually the AI, and this is where now we are today. Thank you.
It's very interesting to hear a practitioner's point of view always, because we come from it from a more technology or strategy point of view. So thank you for sharing, Dr. Asher. Now, I believe that with the influx and onset of fourth industrial revolution technologies, and they are not just limited to artificial intelligence or blockchain, but we're looking at an array of technologies from blockchain to AI to cloud computing to mobile to quantum computing to drones. There is a shift required in every industry that we see. Particular reports that go into details around this is the World Economic Forum's Future of Jobs report. So I'm deflecting the question, so to say, to the Future of Jobs report, because the Future of Job report are a couple of, very smart people, world-leading thinkers that come together to talk about how will this impact the industry that we're in. So in the healthcare industry, it is expected that 10% of all healthcare practitioners are going to be displaced in one way or the other. Either they will require to be retrained, or they will require to be repurposed in some way or the other. And I'm glad that the nursing director is sitting on my right, because the next thing I always have problem with physicians when raising, a nurse in the future, or the nursing department, will be much more important than a surgeon, for example. Because a surgeon, his task in one way or the other can be automated, but you can never actually replace a nurse, right? So the landscape will change, and the opportunity arising there, and this going full circle to your question, Mark, what the opportunity that we see and that we've helped tap into with the Saudi Arabian government, we've actually developed ways that young Saudi nationals can actually tap into these technologies, learn about these technologies, and develop winning ideas with these technologies. In the process, developing patents, in the process, developing local applications, and actually creating an entire industry in Saudi Arabia. So I think there's a real opportunity there for anyone in the room to actually tap into this, to develop an ecosystem around it. Over to you, Vishal.
Thank you so much. Thanks, Mark, for the question, and really a pleasure to be here today with an esteemed panel and a very wise audience as well on digital healthcare. I'm going to add a little bit of flavor of investments on digital health, AI and blockchain specifically. So from a venture capital perspective, I think there are several use cases within the digital health AI blockchain space which are of keen interest to us. And again, there is this dichotomy between traditional healthcare, which begins when we fall sick and we start seeking care. So it's, in that sense, it's slight bit of sick care than healthcare. But when you look at that value chain, I think the first and the foremost use case is around pre-screening of patients before they even land at the hospital or the clinic. And it's done by very well-known things like online symptom checkers these days, which are AI-enabled chatbot thematics. You can have a chat with the chatbot, what the problem is, what the issue is, and you can be paired with the right kind of doctor, with the right kind of time, understanding the severity of the condition. And as you move along the value chain, you're talking more about triaging patients within the healthcare facilities, specifically in the medical emergencies, the ER departments, where every second is crucial to save lives. How do you really triage and prioritize patients? Who's the most important? Who needs what kind of care? So there again, I think AI and blockchain is the fundamental foundation for all of those kind of use cases. Again, moving further ahead across the value chain, you look at things like diagnostics and medical imaging. All medical decision making is actually based on diagnostics. There is a lot of opportunity where technology can be scaled up, can learn a lot of uncommon patterns which can be missed by the human eye. So there is this enablement perspective on technology, on AI, which can help human caregivers become more effective and more accurate in terms of diagnosing diseases. And then last but not least, outside of this traditional value chain, I think there is a huge use case around AI-enabled preventive healthcare, which is much bigger than what we do within the four walls of a hospital or a clinic. So these are some of the use cases, or let's say, issues that we look at, or subsectors that we look at from a VC standpoint. We are very excited about these.
Fantastic. Thank you so much for the opening remarks. And I'll start off by a couple of questions, and then we'll leave plenty of time for the audience to address some additional ones. Maybe Saad, back to you a little bit. We hear a lot about AI and blockchain, and needless to say, there's a lot of buzz around these words. Their interpretation in the real world could mean anything from, being able to automate a registration form for a patient, all the way to, helping excise a tumor, at the OR bedside or whatever it might be. I mean, what is the reality today across the GCC? Who is actually doing this? Where do we see some real world examples? And then more importantly, I mean, how do we accelerate this and really get, the promise of AI and blockchain, into the real world?
Thank you for that question, and I'll start off with, yes, there is a hype. Let's start there, particularly around blockchain. I've been active in this space since 2014. Yes, we've seen real-world adoption. Yes, we've seen it come to life. Yes, if you would have asked me if I could imagine that where we are today would be a reality, I couldn't have, but there is still so much to go. right? So yes, there is a hype, let's start there, right? So, and then now differentiate between blockchain and AI, because AI, if we think of AI as a technology, is much more mature than blockchain as a technology. And also, let's always remember, we're always talking about technologies, right? So these are just tools in one way or the other. Now, artificial intelligence, particularly in the region, and when I talk about the region particularly, I'm looking at some of the two leading economies in the region, GCC, particularly Saudi Arabia and the UAE. Now, in the UAE, we've started seeing artificial intelligence trickle into claims management, right? So rather than someone manually having to realize, yes, is this claim valid, is this claim not valid, there's an element of AI decision-making support. It doesn't make the decision by itself, but it supports whoever is handling it. Talking about oncology, we are now seeing decision support systems based on AI coming in. And this is very straightforward, right? Because how do you identify certain types of tumors? You identify them by looking at the scans. Right? So these scans, rather than using a human eye, you can use computer vision, and that, again, is artificial intelligence. Right? The American hospital, I think, is doing some fantastic work, and I know they didn't pay me to say that, but they have this device. It's called the Da Vinci device. Right? It's also now in its later days of technology adoption, where now a surgeon can operate out of anywhere in the world in real time, supported by artificial intelligence. So that on AI. And AI, we're going to see trickle into our lives much more, and most of us are already using it without already knowing it. All of us are using YouTube and Netflix and the likes, Amazon, and they're all having some AI elements, so obviously they will start trickling into healthcare. Now, blockchain is less sexy, quote unquote, right? It's being made into a lot of a hype. And yes, I do reiterate it is a hype, because blockchain is more transactional. Blockchain is more of the base layer, like my sister Aisha said. Artificial intelligence doesn't necessarily work just with artificial intelligence. You need an information architecture that goes with it, right? So blockchain will help us with this architecture and data structure that we need, right? For anyone in the room, being aware of FHIR, for example. FHIR is nothing but a way that we communicate. Now think about this using smart contracts, right? So it will allow us a way to manage our data more accurately, empower the patient even more, right? And now we all know that there's a push for patient centricity. In blockchain, particularly in the region, we've seen trials for patient records, which haven't yet been rolled out, but people are meddling it. But the lowest hanging fruit for blockchain in the region, and this is where we've seen it already being adopted, is the medical pharma supply chain, right? Supply chains are supply chains, and in the healthcare field, they need there's a lot of regulation that is attached to, let's say, issuing a controlled substance to Slacker, God forbid, to someone that needs this controlled substance. Now in the UAE, Abu Dhabi actually came out and issued a regulation to say that within a couple of years, this needs to be tracked by your Emirates ID. Now think about doing that on blockchain. Rather than having the Emirates ID Authority on one part, the pharmacy on one part, the hospital on another part, think about how a blockchain transaction system could put all of this together and help us manage these cases. I'll put a stop there, else I'll continue going on and on. So it's a pleasure.
No, absolutely. I think great examples of how there's really variation and maturity across the system. How do you accelerate this field? How do you catalyze this?
I think education is probably the most important part, right? Because even us sitting here in the room, and obviously we are interested in this, else the esteemed guests would be sitting here to think about it. Education is key. And I'll take myself as an example. I am self-taught on blockchain. In 2013, I started reading about it. 2014, I started writing papers about it. I started developing methodologies around it. Knowledge is there for the taking, right? And particularly on artificial intelligence and blockchain specifically, right? So it needs to start with anyone that is interested in this it needs to start with education. Education is key. The second element to this would be the development of some form of ecosystem. If it was artificial intelligence or blockchain, these aren't sports that we can play as a single organization. It doesn't make sense anymore. We need to start developing value-based connections, and in this case I call them ecosystems, and these ecosystems need to have particular players. So think about this panel, for example. This could be a perfect ecosystem. We have a gentleman from consulting. We have someone that is an actual practitioner in nursing. We have someone from that would like to invest in it. We have someone that's advising in this, right? Each one has a different element to it, and each one is very important in this case, right? So it's education, ecosystem creation, and supporting through the right funds the right ideas. And I'm very happy that in the UAE and also in Saudi, we need to give credit to the Saudi government in that as well. They're very actively supporting these initiatives.
Fantastic. So maybe let's build on the theme of the ecosystem and then, run across the various other stakeholders in the health system and see how do we build on this ecosystem. So Aisha, we know that change happens when frontliners adopt the tools and actually, make a difference when it comes to the patient care that they're delivering. We've heard in your opening statements that Saha is already turning the page, starting to develop some of these tools, bringing them into real-world practice. What are some of the learnings from the Saha experience around helping disseminate those tools, getting physicians, nurses, frontliners to actually buy in to the use of AI, blockchain, other technologies, and actually integrate them in their clinical practice to actually make that difference? What are some of the learnings or best practices that you've seen?
I'm going to echo what my colleague had been just said now. It's about education. When we realized, let us say, and let us take the nursing target group as a target population, because usually we are always at the bedside taking care, tangible care that we are providing for the patient. It was very difficult for us to digest and to think that it's really the AI and the technologies will help. We use with the traditional method that the nurse will provide the care, patient will improve, and he will go home. And we connected having that traditional inherited way of thinking that it is more for radiology, it's more for the robotic surgeries, and it's more advanced technologies. We are going to see it in, for example, if it's in education simulation. We realized that time that nurses left behind in a way that they should really come up front with all these changes that's happening. How we can integrate that in the practice, looked into the advanced technologies that will help in taking care of the patient. Like, for example, we have Vocera here, where it is like advanced kind of a communication. It will help in order that we be there for taking care of the patient. Safety net, a kind of a new solutions, where always to reduce the alarm of the patient, and their nurse can be there. But however, as nurses are really prepared for it, we started building their competencies and skills and understanding the basic concepts of data. We wanted really each nurse manager and the charge nurse in the unit to understand, if I have this number of data, what it means and what it reflects to me. This is number one. Second thing, it's about building some of the middle line managers to be ready for this future. So among all who are here, maybe they are a self-learner, they started to study or to know what is the meaning of the AI, what are the data analysis, but we embedded that as a part of the competencies for the nurses. Saha developed something called a kind of a dashboard. It's a kind of a complex business intelligence, where actually if you will click on it and you will see the trend, for example, of the length of stay. A length of stay for a nurse who is actually leading a few members in the unit, maybe it doesn't really an important information for her. But after we made it that it's a basic competency and everybody should log on to that, it's able to predict with these data, am I going to have a kind of a prediction to have a readmission rate for this target population or no? So basic is about understanding of the meaning of the data by building the competencies and education and training. Allow me to add just one point. I'm sorry for that.
Go ahead, please.
You mentioned earlier about raising the expenditure in the healthcare. One of the things that where we wanted really to see, because UAE were one of the advanced or pioneer in the country in the GCC to introduce actually the EMR. We have a retrospective data of almost like 10 to 20 years. we did not really utilize that histories of the data that we are having it today accurately in a way that there is a high cost. The hospitals are suffering of the proper reimbursement. We are under the mandate that we should generate revenues and the profit, under the mandate that to meet the expectation of the patient and the access of the care is really limited. Then one of the things that we really didn't work on it really very aggressively and in a smart way. If I look into these data, and then I can develop and design algorithm with the AI to help me to model that how much I can predict the rate of the readmission in a way that I really reduce the cost and the burden of utilizing the inpatient, and I can really reduce the length of stay. In all the board meetings, you will say, okay, you have to reduce the length of stay by X target, and everybody is looking into the ground by, okay, you have to provide admission. All the medical need to align with the pathway, but this is not the conversation today. That's from my side. Thank you.
No, fantastic. And maybe building on that, I mean, nothing happens without a business case, right? And nothing will happen without funding and a return on investment. Vishal, on your side, I mean, when you're scouting for opportunities, you're looking to invest in startups, what is the criteria that you use? And what do you need to see demonstrated in order for you to actually support some of these early startups and help bring these technologies to market?
Thanks for the question again, Mark. So venture capital dollars moving into a certain sector or a subsector is a sort of a validation of strength of a value proposition and even the long-term impact that such technologies can actually create. When we look at digital health, when we look at opportunities, I think there is a multitude of opportunities that can create long-term impact for the region. We've seen that at the global scale, and we see a lot of those things coming up now here in the region as well. From a problem standpoint, I would say there are three things that we look at. So first and foremost is it a real problem that needs to be solved? And sometimes you don't realize real problems. The pandemic unraveled a problem where everything got locked down. You couldn't even go to a doctor. You couldn't even speak to a doctor. Everybody had to adopt an alternative model of virtual care. Everybody had to go live with their virtual consultation platforms. Everybody did that. And then when you move ahead, things like, which Sakra mentioned about, data and platforms which work at the back-end office. So for example, looking at data, churning that data and creating non-medical insights. So revenue cycle management, claims management, how do you really automate those processes and unlock a lot of dollars which are stuck there for months and months? How do you really impact or how do you really reinvest those dollars to create better clinical outcomes for the patients? How do you go about doing that? Another thematic that's of very keen interest to us is digital therapeutics. So we believe, and again, it's happened in the Western world. Right now, there are doctors who are prescribing mobile applications along with pills and medicines to take care of, let's say, issues like ADHD, mental health, etc., etc. And we do believe that kind of an excitement will trickle down to the region as well. There are opportunities. We sit on some sort of a time bomb from a chronic disease management perspective. The kind of percentage population is at risk is massive. So some of these technologies would be very relevant. And again, last but not least, I spoke about this earlier in the previous conversation as well. The retail wellness opportunity is massive from an impact and investment ROI perspective. Right now, healthcare is only taking care of 5 to 10% of people who are sick and who are ill, who need care. 95% of the population is outside of this ecosystem. Traditional hospitals, and I worked for a hospital system which was one of the largest system here in the region. We don't have the most efficient and effective ways of engaging with this 90% population which is healthy, not at risk right now, but how do you go about doing that? I think technology will play an amazing role there. We as end users are getting into the driver's seat in terms of making not clinical decisions, but healthcare decisions for our own selves. I think technology will play an enablement role there as well. And I think broadly, these are some of the exciting aspects of, or let's say the subsectors within the healthcare space that we look at from an investment standpoint.
If I may, I love the fact that Vishal is bringing these things up at how we're moving more towards well care than sick care, right? And for anyone that maybe isn't in the subject matter, think about the doctor's office today. The doctor's office today, if you Google an image from the late 18th century, you'll find the doctor's office looks just exactly the same way, right? You still have the bed, you still have a curtain, you still have a desk for the doctor. So when we think about how much opportunity exists in that space, think about your airline experience or your hotel experience or your banking experience, how much that has changed in the last couple of years. And now think about how healthcare is equally ripe to be disrupted by these technologies, right? Just by a show of hands, who has some kind of Apple Watch or Fitbit or, right? That's the majority of the room if I look around. Think about actually using this data, which is being tracked already. It's, you know, it's on your arm, it's being tracked on servers. Now think about how you could use that data to your benefit. There is such a massive value proposition here just on wellness and well-being. You didn't sleep enough, now drink more water. You didn't drink enough, now take these supplements. You didn't eat right, now go to sleep a little bit earlier. The opportunities are endless. And then you trickle on top of this now the next wave of technologies, which is virtual realities, right? And then suddenly you're immersed in a world where really you're thinking about, okay, will I ever need a psychiatrist again? If I have all of these data elements available to me, if I have the therapeutics available to me in some kind of virtual world. Anyhow, I get very excited about these topics and I could go on and on. I'll play it back to Mark.
Wonderful. Thank you all for the insights, and just want to make sure that we get a chance to hear from the audience as well. So handing the floor over to the audience members, I think there's somebody that's going to be running mics. If you could just announce your name and the organization that you work for, and then we'd love to answer the question. The gentleman over there has a question.
Hello, lovely discussion. And my name is Dr. Ramzi from Capital Health. And I'm a physician, and it was lovely to listen to you guys talking about AI, blockchain, the different algorithms that are going to improve RCM, supply chain, financial outcome measures, and the quality of care measures and different KPIs. And then I realized near the end that we went to an extreme that I may want to raise a few questions, but the answer may not be ready now, but maybe in another 50 years. So I like artificial in front of intelligence because it's made by humans through an algorithm. The algorithm was created here in the Middle East, not far northeast of us, by Al-Khwarizmi, and it follows similar to a blockchain, like if not this, then that, and you move down a decision tree. But what about wisdom, not intelligence? So I can be 17, be very intelligent, but my grandmother is wiser because she knows when to apply which algorithm. So there was a remark about one day a machine can replace a surgeon. Maybe in another 50 years, 100 years, when a machine will become wise. Now, if I give it an algorithm, and suddenly something unexpected happens, it'll just continue its surgery. So God forbid it goes into an artery that's not supposed to be there, it'll just continue. But a surgeon would know to stop. You have an earthquake, suddenly the surgeon would know what to do and how to counter and change the algorithmic thinking into wisdom of what should be done next. Also, there was a remark about wellness. An interaction between a physician and a patient. Health is not only physical, it's mental and social. Yeah. How they grimace, how they feel, your EQ of seeing their eyes go watery when they discuss a certain topic, where you stop, hold, wait, address it in a different way. So the feedback that goes into your brain when you conduct a bedside evaluation on an antiquated bed in an antiquated office that looks like it used to 100 years ago, because a human still looks the way it used to 100 years ago. It still has 2 legs and 2 arms and, you know, a heart on the left side most of the time, and eyes, and, you know, the exam is still the same. So if we were to say that we wanted a fancy bed and a fancy clinic, who says the patient will be comfortable? And remember, this patient is probably elderly coming from a different generation. Why do I want to force upon him a very fancy bed and force on him technology that may not make him feel warm like he would be at home? So keep in mind, health is social and mental, in addition to physical. Wellness, let's take the iWatch and Google. How many times, if there's a physician in this room, you've been called by patients that have read things on Google where they're terrified and panicking just because Lord Dryden says a little knowledge is a dangerous thing. So I know the heart rate is fast. What do you do about it? Do you panic? If I have all the data in the world that I walked 10,000 steps, I have a heart rate of 92. What good is it if I don't know what to do with it? So again, ECG by Apple Watch, then suddenly there's an abnormality. The amount of false positives that raises alarms probably in the future will be reduced by machine learning, intelligence of the engineers, and all that. I just want to put a break on the thoughts where we go too much into the era of, wow, technology. I realize you're technology gurus, but I favor Dr. Aisha's approach. Technology is here to help the wisdom of humans, and at this stage is not ready to disrupt a physician's role in society from all aspects. And actually, for me, it takes much longer with technology to do my job. When I had a paper and a pencil, I was much better off. But this is my opinion. And nevertheless, I just want to caution you that we need to know where to stop with technology and when it's ready and when not. And I thank you for this wonderful, wonderful discussion.
And thank you, Dr. Ramzy, and much appreciated, and thank you for bringing that focus. There is nothing that you said, Dr. Ramzy, that I can disagree with. Absolutely nothing. You're right on every single point. Having said that, and actually that's also why I started with saying it's an absolute hype, right? Real artificial intelligence, even in that way that we know of Terminator or someone that can actually interact, is so far ahead, we don't actually know when it's going to arrive. Having said that, what my remarks particularly is just to spark thinking in a particular direction. There is no way, I don't see how a human can be replaced in one way or the other by technology. These are just tools in the end. So I don't disagree with anything that you said. Thank you for focusing back. My remarks particularly are to spur thinking, right? Because the opportunities are now arising. How they will be impacted, how they will change the way we know, God knows, right? If you go to Michio Kaku, for example, he's a leading futurist and thinker. He goes as far as even saying we will never even see a human being as a physician anymore because it's all nanorobots and electrolytes and scanners that we have in our system, right? So the opportunity exists, but you're very right, there's still a very long way to go.
I was just going to add one more thing, Dr. Ramzy. And again, like Sakra, completely agree with whatever you have said. The idea here is technology will never replace the human touch of a caregiver. That's far distant away if it happens. What technology does is it enables, improves, let's say, makes the process more efficient, more productive. So that's what technology does, and that's for what we look at technology, from that perspective. So that's the lens that we are looking at technology from. Thank you.
No, I think a fantastic comment that really highlights the tools are only as useful as people are willing to take them on, adopt them, and to bring them into clinical practice. So thank you for the comment. Any additional comments or questions from the audience? I know we're close to time, but maybe just a final perspective from the panelists. We've talked a lot about stakeholders, from investors, from frontliners, from startups. We haven't talked about patients. What does it take for actually patients to demand this, to ask for this, to want to see this change? Because that's how we'll see a little bit of change within the ecosystem, is if it's not just around the technology providers pushing applications, but actually the patients seeing the benefits, the use, and actually understanding how that actually impacts them. Maybe Aisha, from your experience, as a chief nursing officer and running through some of these programs, what have been some memorable moments with patients where you've actually seen maybe this paradigm shift a little bit and them starting to understand the value, the use of these applications?
See, if I were the head of the patient, for me, whatever the solution, the advanced solutions that you are going to use, whatever the kind of a complex data analysis you are going to do it in a way that to make sure that I'll get the right care. As a patient, it's very two important thing. I get the good quality of care, so when I go out to the hospital, I'm fine, I'm healthy, I'm with my family. And if I'm getting sick, I need to get an access of care. So I will not be blocked by the other healthcare facilities or by the other institution, or you know what, you are not eligible for that. This is what the patients are looking for. And this is where, when we talk about the wisdom, am I really utilizing the artificial intelligence to achieve these two goals for the patient? Or am I just using the artificial intelligence in a way that just kind of a purely business mind? I want to generate revenues, I want to add profits, and this is where I can see my organizations among the competitors in the market. This is the wisdom that what Dr. Ramsey was talking about. So the patients at the end, he will be happy if we'll say that, oh, Vocera helped actually that before, I'm not gonna die because it will alarm to the nurse, and on the spot I'll get the nurse here on the spot, then he will value that kind of a technology. If I'm at home, I cannot make a visit into the clinic, the teleconsultation or telenursing will help me to know and to understand, these are the medication I'm taking it, these are the complications that I'm gonna have, and I need to predict. This is where he will value that, oh, this technology has really helped me. This is what the patient is looking for. Thank you.
Wonderful. I can't think of a better way to conclude than by putting patients back at the center of things and making sure that whatever we do is a means to an end on actually improving outcomes for patients. So please join me in welcoming the panelists. Thank you very much for your time.
Okay, everyone, this concludes our third annual Healthcare Disruptors Congress. Again, I want to thank everybody for being part of this. I want to thank our delegates for being here with us, especially those who stuck around till the end of the conference. It's always a challenge. So thank you very much. I want to thank all of our speakers. We had 24 speakers today. I want to thank our sponsors, GE Healthcare, Vocera, MyHamp, and MPC. I also want to thank our team who has worked very, very hard, Ubay and Diamin. Thank you all for your effort. I want to thank Kareem for putting together a great lineup of speakers and content. Unfortunately, you couldn't be with us today. And I want to thank all of our team members who have worked relentlessly back in Beirut in order to help us do the event. A special thank also for Ahmad Al-Banna, who chaired this event so eloquently. So thank you, Ahmad, and thank you all. Hopefully we'll see you on our 4th edition next year. Thank you.